Not working? Good morning, everybody. I'm going to call the meeting to order and welcome. Thank you all for coming today. It's great to see so many here at Health and Social Services. Much appreciated. So can we have a roll call, please? You're in trouble. Okay, so we have quorum. Thank you. So I would like, if is there a mover for the adoption of the Health and Social Services Committee meeting December 7th? Thank you. And a seconder? Thank you. Did you get it? Dan was second. There are no statutory meetings, public meetings today, but we do have 4 presentations. And we're going to start off with presentation 5.1 with Dr. McTavish, who is going to give us an update on the respiratory virus illnesses. Thank you. Welcome.
Morning, welcome. Sorry my back is to you all. And I'm sure you have to listen to health before you get to social services. We'll be brief. So thanks for having me. Good morning, everybody. So I'm Peppy McTavish. I'm the Associate Medical Officer of Health. I work in the health department here in Dr. Kyle's office. And the last time Dr. Kyle was here talking about our COVID update was in the spring, so we thought it was time to come give you another update. There's been some exciting things happening, but I will be brief, so no worries. Happy to answer any questions at the end. So we have a new data tracker. We're very excited. So this is in most part due to our health analytics and research team, our EPI team. They're excellent at the health department, as you know. So we used to have this great COVID tracker, and now we've combined it with COVID and influenza. So all the great information that you had before is still there, and we'll go through that in the next few slides. But now it's sort of more streamlined, a bit more of a summary. So I really like this slide. This is on the first page when you get there. It tells you the information for the previous week. As you remember, it gets updated on Wednesdays for the week before, right? So there's sort of a week delay. So this was updated yesterday afternoon. So we have the numbers, but then we also compare it to the numbers from before, because before you had those big graphs, which are good, but I find this a little bit easier. So you can look at the arrows and say, how does this week compare to the week before? So this is excellent. So if we look at our confirmed cases, our outbreaks, hospitalizations, everything is decreasing. Wastewater is the same and stable, and I'll describe that when we get to that slide. And then for influenza as well, decreasing cases, and then our outbreaks are stable. So this is a really nice snapshot about what is happening in our region. So here, just like before, we have our COVID and influenza cases. So the respiratory season, sort of for respiratory illnesses, is usually sort of October to April. That's pre-pandemic. Now it's sort of out the window. But when we count the season, it's from August to August. So this 2023-2024 season, respiratory season, is from the end of August of 2023, and it will go until the end of August this summer. So since August, we've had almost 2,500 confirmed cases. That's still a lot, right? Like that's a lot of people in our community who are still getting sick, and almost 400 cases of influenza. And you can see here the distribution between influenza and influenza A and B. A lot more influenza A than B, and that is typical for influenza. The typical influenza season is there's a lot of A sort of right before the winter holiday, and then a little bit of B after the holiday. We haven't seen that pattern since COVID because we had all those measures in place, right? So we saw almost no influenza, which was wonderful. So we're back to seeing it now in our community. So it's hard to know what influenza B will look like sort of coming up in the next few weeks. And then for COVID case, unfortunately, there have been 12 people in Durham who have passed away with COVID and 163 hospitalized. But if you think about this in relation to what we had, last season, the season before, and the season before in the winter season, this is markedly decreased, mostly due to vaccination. And we don't have influenza death data because it's not reportable to the health department in the same way that COVID deaths are, which is why we don't report it. So institutional outbreaks, so again, this is institutions are hospitals, long-term care, retirement homes, and the information in the graph just reflects the numbers above. So 132 outbreaks since the fall, that's still a lot, predominantly driven by COVID, as you can see here, 103 of those are COVID. A lot of other respiratory, so when people get sick in long-term care hospitals, they do a multiplex swab, sort of like we want to know what you have. You're sick. A test for flu, COVID, Human metapneumovirus, adenovirus is the typical sort of colds that you see in the community. So 22 of those outbreaks were other respiratory, like the ones I listed. A little bit of influenza A, not sure about influenza B yet. We may see that in the next few weeks. And then RSV, which we can talk about in a bit. So from the graph here below, you can see that we've had lots of outbreaks since August and predominantly driven by COVID in the blue there, and no light green. But if I present in the spring again, we may see some influenza B. Okay, our vaccine administration. So this is a lot of vaccine. So we're now at 1.8 million COVID vaccines since the beginning of the pandemic. And I vividly remember Dr. Kyle presenting when we hit 100,000. So this is remarkable. And you sort of get choked up when you think about how much work this has actually been over the last 3 years for the region and our partners in the community. So if you look at this, over 1 million still provided by community hospital clinics. That's us and our hospital partner. And although the pharmacy one is lower here, almost 500,000, pharmacy is really now doing the bulk of vaccinations, and that's by design. And although it's hard to see here, I wish we could zoom in on the right side of the graph, but the right side of the graph, that peak that you see there, that's the new XBB vaccine. That's people who got their boosters in the fall. And if you notice that real drop off there at the end, it seems to be that people who were able to get vaccinated have already, and people who don't want to be may not be getting vaccinated because we're finding there's much less vaccination right now. Excuse me. So vaccination coverage, so this again is on the tracker, and just important to point out. So if you look at the second one from the top there, the percentage completing primary series, we don't really use the term primary series anymore. It's more, are you due for another vaccine? Are you eligible? You can get it. But almost 80% of people in Durham, that's for all ages, got their primary series. That's pretty good. Like we're very happy with that number. And then if you look at the bottom there, the percentage receiving any vaccine within the last 6 months, that looks low. So you might look at that and say, ooh, that's not a lot of people. But that is the people who were eligible to be vaccinated. So in the fall, the province put out recommendations. If you're older, if you have comorbid conditions, get vaccinated. And then I didn't put a slide in, but if you click on that 80 plus on age group there, you'll see that about 50% of those 80 plus did receive a booster or the next COVID vaccine they were able to get, which is very good. And many people are still, although they might not be vaccinated, they have a lot of protection. They've had 4 or 5 vaccines already. Maybe they've had COVID a few times as well. So they're still quite sort of immunized without getting their recent booster. So wastewater surveillance, so I said I'd talk about this. So when it's stable, that's good. Wastewater gives us a really good idea of what's happening in the community because not everybody can access a test, as you know, right? A COVID-19 test right now. So there's 2 wastewater surveillance stations. We used to have 6 or 7. In the spring, it went down to 2. And it's stable, which is good. So if it's stable, it means it's not increasing, which we like to see. And we're not sure if it's decreasing yet because over the holiday, there was less sampling taken. So now there's only 1 sample. So it could be by the end of the week when the data is updated, we might actually see a decrease. We'll have to see. But stable is good. And childcare and school absenteeism, again, this is another marker in the community about how we're doing for respiratory illnesses. This is the data from before the winter break, because if I showed you the data from yesterday, it says no data, because there's no kids in school. So school absenteeism and childcare absenteeism is a good marker about how we're doing in the community. So these are good, stable numbers, and as you can see from the graphs, there were no big increases before the winter break, which is good to see. And then our current COVID and influenza vaccine plans, so people who are 6 months and older, who are up to date, were recommended in the fall to receive that booster dose of the XBB vaccine, as long as it had been 6 months, or in some cases 3 months, since their last infection or vaccine. And people could still get that at our COVID vaccine clinics at the health department, although we are running less. So they can just book here at durham.ca vaccine appointment, or any pharmacy or their healthcare provider if they are. We haven't heard anything yet if there's going to be a call for a booster or additional vaccine in the spring, so we will let you know when we hear that. And then for influenza, I know we're sort of thinking about getting past the influenza season, but you're still eligible if you're older than 6 months, and I recommend you do get it if you haven't yet. And most pharmacies have that, and most of your primary care providers do as well. And we're still doing homebound vaccine as well for COVID-19. That's not going to stop. And then the RSV vaccine plans. We've had quite a few questions from community members about RSV. So if you remember, in August, Health Canada approved the RSV vaccine Arexvy for those 60 years and older. So it's a provincial free program for those who are 60 years and older living in long-term care, elder care lodges, or retirement homes that have a specific dementia care service, and we have 8 of those in Durham Region. And then recently, in the middle of December, they expanded it to others. So if you're still 60 or older, if you're in a hospital and you're an ALC patient, that means you've been discharged for the reason you're in hospital and you're waiting for a long-term care bed. So you can receive it. If you're getting dialysis or you've had a transplant, if you're homeless, or Indigenous individuals can also get it as well. And then if you are not one of those, but you're over 60 and you'd like it, you can get a prescription and go to your pharmacist. They can't give it to you, but they can give it to you to take back as a prescription, and your healthcare provider who prescribed it can give it to you. I think it's about $250. Okay, so our current recommendations, last slide. We always recommend the layered model, that sort of Swiss cheese model, to make sure that we can stay safe. So please make sure you and your loved ones are up to date on your COVID influenza vaccines, or RSV if eligible. Wear a mask if you're still in sort of higher risk situations, if you're a higher risk individual, if you're on public transit or places where you feel like you need more space. Please make sure you're aware of the recommendations of places you need to go. Hospitals and long-term cares still have some masking requirements. Stay home when you're sick. Wear a mask until day 10 from symptom onset. Remember, we saw that slide with all the other viruses that are out there, those other 22 outbreaks. There's lots of things that are still outbreak. Wash your hands often, chicken wing, cough into your elbow, and then regularly cleaning high-touch surfaces. And that's it. So I'm happy to take any questions.
Thank you very much for your presentation. I do have a question from Mayor Foster.
Waiting for that red light. Mayor Carter just asked me to please, if you could clarify the chicken wing comment.
Cough into your elbow like you teach your kids.
All right. Do sauce? Never mind. That was going somewhere I did not intend to go. So I am going to channel my my inner Mayor Carter. Good morning. Happy New Year. I'm just like Mayor Carter, but less. Dr. McTavish, thank you. Just, I guess, a quick observation. While we've moved away from the pandemic and we look at the numbers, I think we've perhaps become a little bit complacent. Going back to the numbers, I think we all saw comparators with areas that did not implement some of the safeguards that we did, and the deaths per capita. You may want to remind yourself of those, and even looking at the US, the difference between states, the number of people per 100,000 that were allowed to die. You and your team, doctors, helped us here in Durham Region. So there are people alive today that would not be alive today. We are enjoying friends and relatives that we wouldn't. So please, please take that back. A quick question: Have we learned enough, or have we taken enough of what we learned during the pandemic, to the ongoing issue with influenza? So there was a great deal of hesitation frequently for vaccinations. People working with populations that need to be protected, whether we're looking at schools, seniors, residents, whatnot. And I guess this is an opinion bit, and you can say I don't know or dodge the question if you want. But we learned a lot, and are we transferring that in a progressive fashion?
So it's a great point, and I think yes, I think people are much more compassionate towards the other members of their community, and we've seen that with the public health measures, right? People are now, if there's an outbreak, people are much more likely to mask and to do the things that the homes are asking them because they know how important these measures are. We saw during COVID there were 0 influenza cases, 0. That's tremendous. So you're right. How do you go back? But I do think that people are more likely to do the community measures because they've shown that they've done it for years now. It'll be interesting to see what the vaccine uptake is for flu this year. So if we come back and present to you in the spring or next fall about this, we would be happy to present on that because it would be nice to see that influenza vaccine rates increase in the community because people take that mentality of I'm doing this for the rest of my community. So it's a good point.
So I'm anticipating the emails hitting my inbox right about now. But beyond being compassionate, are there things that we should be looking, whether it's provincially here, if there are individuals that should be taking precautions, should be getting vaccinations because they are dealing with, I'm going to call it sensitive, my vocabulary isn't working this morning, I've only had 1 cup of coffee. Do we need to be more than compassionate?
So I think we are. So the province back in November was looking at the increased respiratory rates that were happening, like the outbreaks in long-term care homes, on retirement homes and congregate living settings, and they reintroduced masking for staff. And that's hard to do, right? Because there's some good pushback from families saying maybe this isn't what we want. Let's not take a broad approach like that. So the province did step up and say, yes, no, this is important and we need to implement this again. So yes, people are they're being more than compassionate. They're making good decisions
So
based
you
on
saw,
the
you
evidence.
saw me chuckle. I'm chuckling at myself because I can't tell you when I last wore a mask on that. The second question, if you look at the wastewater and the monitoring, is there any difference between Durham, so we're stable, and any of our neighbors? So are we doing better, worse? Is everyone in about the same space? Do you know, I guess, would have been the first question.
Yep, we take a look at how other areas are doing. Sometimes we'll see pockets in the north that seem to have higher wastewater samples. Not everybody's doing wastewater sampling either, but we are definitely sort of stable along with our close neighbors
Great.
here in Durham.
Thank you, and again for all the work and not just Health and Social Services, the entire team. Thank you.
I'll just make one more comment. Thank you for mentioning, the work that everyone here has done, but really it's been the members of the community who have done the most remarkable things to keep our community safe. So, thanks.
Thank you, Mayor Foster. I now have Councillor Pickles, who has a question.
Yes, can you?
Why can't we hear him? Sorry? We lost him.
Can you hear me?
Now we can. Thank you. Hang on a second. We're just experiencing a problem. We can't hear you. Try again.
I think you can hear me now.
Yes.
Perfect. Thank you. Pepe, I'll just continue on from where Mayor Foster was. You and Dr. Kyle and your whole team were incredibly helpful during the pandemic and since. So thank you very much to you and your teams. The question I had for your delegation today is, I guess, a couple questions. One, there was a slide that showed 2,500 COVID infections this season. I assume you would expect that a lot of people, my neighbors up the street, they don't feel well, they test for COVID, it tests positive, they stay home, they don't necessarily go to their doctor, they don't necessarily report it. So is your number of 2,500 maybe not representative of everybody who may have had COVID? And what would it take for it to come up in your statistics?
Thanks, Councillor Pickles, through the chair. It's a great point, and sorry if I wasn't highlighting that enough, but absolutely, that is just one piece. I don't know what the extrapolation number really is. Maybe we'll see that in post-pandemic studies, but that's, you're right, sort of the tip of the iceberg. These are people who can access tests. These are people who go to emerge, they're sick enough, they're admitted, they're in long-term care, so they get the swabs, retirement homes. So it's a small piece, you're right, especially for influenza as well. But that's why the childcare and school numbers, absenteeism numbers, and the wastewater signals give us a much better idea about what's actually out there in the community. But it's been, 2 years now since people have had difficulty accessing tests in the community, so it's still rumbling along. Yeah, it's a good point.
So if people go to their doctor, they go to the hospital, or they, go nursing station in long-term care or something, that would get reported in your 2,500. But if somebody just sort of said, well, I'm going to stay at home a few days till I test negative, that wouldn't necessarily get that wouldn't get recorded anyway.
That's correct. So home tests, we have no idea about. It's only the laboratory tests that get reported to us. Yes.
So you wouldn't know if the real number, as you say, extrapolated would be 3 times that or 4 times that or double that, or you wouldn't necessarily know?
No, we would have no idea. But the wastewater, again, the school absenteeism would give us a sense of what's happening. And then long-term care is sort of a canary in the coal mine, because that's people live there, right? And the disease comes to them. So when those outbreaks really start getting high, that tells us that community transmission is also high.
Okay. And another slide showed the number of, or percentage of people who had gotten the various vaccines. So the way I look at it, I've got my fourth shot. So I got 1, 2, 3, 4. And if I were had health issues or were older, I might even have a fifth or sixth shot. I'm not sure. But I think you said the primary uptake was about 80%. But it seems to have declined. There are fewer people who got the second shot, even fewer still who got the third. And I know a lot. I've got my fourth, but I know a lot of people who haven't gotten a fourth. So is that of great concern to you? Is there a big message that people ought to catch up on those shots, or is it in some way only the most at-risk people who ought to get these shots, or is the message everybody should, just like the first one?
I think the province has done a really good job of messaging about that, about if you're in the higher risk groups, you need to get vaccinated, you need to get vaccinated now. I know there were robocalls the province put out if you were eligible. You got phone calls. I think it was Dr. Moore's voice saying, please get vaccinated, it's important. So I'm not sure how else it can be messaged in the community. We did a lot of messaging as well. Some people, I think, just feel I'm comfortable vaccinated where I am. I've had 2, 3, 4. I've had COVID a few times. I'm don't have comorbid conditions. People are making those decisions. Would I like to see slightly higher vaccination? Absolutely. We're obviously very pro-vaccine. Right now, I'd like to just make sure that the vulnerable communities are protected, right? Like in long-term care, staff and residents are vaccinated, and same with congregate care and retirement homes. So I think that's sort of where we need to keep going for targeting. But we'll have to wait and see
Okay.
if there's another wave. Maybe community may want to get vaccinated again. We'll see.
Okay. Well, thank you very much. Thank you for your presentation. Thank you, Doctor. Thank you, Chair. And I appreciate the committee giving me an opportunity to ask a couple questions. Thank you.
Are there any other questions to Dr. McTavish on this presentation? I don't see any, so thank you very much. Oh, I'm sorry. Couldn't see you over there, Councillor Crawford.
Sorry, no offense to Steve. Good morning. Thank you for everything you did for us over the last few years and still continue to do for us. The report recently around rapid tests and the effectiveness or the accuracy of rapid tests. Can you comment on that? Like, if I do a rapid test today, and let's say I have, I don't know, a slight cold or whatever, and I do a rapid test and it's a negative, am I assured that I don't have COVID?
Thank you for the question. Through the chair, I'm not sure I've seen a recent report about the rapid tests. If you want to send that to me, I could take a look at the specific one. But
Yeah, it was on TV, I think. Something about. Oh, well, it was the news. I mean, is it fake news? Maybe, I don't know. Yeah, something about how the effectivenesses of it was like 30% or something, and
oh, I haven't heard that.
on the results, or I can't exactly remember all the thing, but it made me wonder about, if I take a rapid test, am I assured that the results that I'm getting are accurate?
So it's a good question. People certainly relied a lot of them during the pandemic, and it does have the instructions on it, right? Like you need to be symptomatic for so long, so there's enough sort of viral load so it can pick it up in the swab. I think it's a good measure. It's one more way we can say, do we have something? Could you test again the next day? Sure, if you have access to tests. But if you're symptomatic and you test negative, I think you're pretty clear to say, right in this moment in time, there is no virus particles in my nose or my throat where I tested. But if you're symptomatic, you need to be wearing a mask, staying home, doing all the other things anyway. So it's one more piece.
Right.
Yeah.
I will say that RSV is no joke. 2 of my family members ended up getting it, and they are still they've been a week and a half. Just it is no joke. So anyway,
Through the chair, thank you for commenting on that. It does, like right now we have 8 RSV outbreaks in long-term care,
Yeah.
and certainly in babies, it is absolutely no joke. So
Yeah.
it's nice to see the publicly funded program, and it'll be nice to see what happens from that going forward. But
great.
thanks for
Thank you
saying that.
again.
Thank you, Councillor Crawford. Are there any other further questions? Okay, I don't see any. Thank you. Thank you for your presentation. So next on the agenda, we have 5.2, we have Mackenzie DuPont and Ashley Johns, who are the case coordinators for the Income, Employment, and Homelessness Support Division, and it's regarding the Ontario Works Trusted Youth Program. Welcome.
Good morning, everyone. I'm Lisa McIntosh. I'm the Director of Income, Employment, and Homelessness Supports, and I just wanted to come up and give a personal introduction to Ashley Johns and Mackenzie DuPont, who are both case coordinators, and they're working with the clients in the Trusted Youth Program. And as you're listening to their presentation and they're providing details of the work that they do with the individuals in the program, it's important to note that they are 16 and 17-year-olds who are in receipt of Ontario Works as sole support individuals. And so Mackenzie and Ashley provide support to that program. The program is run uniquely in Durham, and so they will be sharing details of that as well as a brief overview of a couple of our other youth programs. So I'm going to turn the podium over to both of them, and thank you so much for being here this morning.
We're going to have to adjust this because of our height difference, sorry. So good morning, everyone, and thank you so much to the Health and Social Services Committee for having us here today. My name is Mackenzie DuPont, and this is Ashley Johns, and as Lisa shared, we're both case coordinators in IEHST. So Ashley and I both operate the Trusted Youth Program through Ontario Works, and we're going to share with you today how we use that to support and empower Durham youth. So before I jump in, I will say I'm a very fast talker on a daily basis, and coupled with nervousness and a little bit of passion, a lot of passion actually for the program, I might talk even quicker. So if I'm going too fast, feel free to tell me to slow down. So giving a little bit of history about the program, prior to it being created, anybody that was 16 or 17 that was coming in to apply for Ontario Works was coming in the same way as an adult. So as you can imagine, somebody who's 16 or 17 and might find themselves homeless or for whatever reason not having that parental support, it's really intimidating and really nerve-wracking when Ontario Works is really a complex system fitted for adults. So we were finding sometimes that our youth were falling through the cracks and they really weren't getting the support they needed in order to move forward with their lives. So we as service providers had to do something to make a shift in order to make this program actually work for our youth as well. So, there we go, perfect. What actually is our program? So if we were to define what the program is, it was created in 2017, and it's a wraparound service model delivered in partnership with youth serving agencies in the community, providing enhanced service delivery to Ontario Works clients under the age of 18 that are not living at home. Now that all sounds lovely, doesn't it? But what does that actually mean in real life? So it means that Ashley and I understand that we are not the experts in everything, and we're really not working alone. So we are working very closely with those youth serving agencies in the community to make sure that our youth are supported with their identified needs. So you might hear us say things today like we're offering warm handoffs or we're offering wraparound support. So that could look like us potentially going to a dentist appointment with a client, going to a school meeting with them, making calls with them, or even going to a community agency for the first time, because they've shared with us that they don't love doing that. It's very uncomfortable for them to go somewhere for the first time, or they might not even know what's available. So the goal for us is to really work with these partners and to create a support network for our youth that they're going to be comfortable with. So the next point also shares that we are meeting these clients where they're at. So Ashley and I are really putting these clients in the driver's seat to determine what a successful future looks like for them. So what we're doing is really making sure that they are having a voice in what the process is. And Ashley and I are seeing where we fit and where we can add value to that in order to get them to a point of being self-sufficient. The goal, truthfully, is to get them to a point where they can be independent, because Ashley and I aren't going to be in their lives forever. And then finally, it is a specialized caseload. So what that means is that Ashley and I only hold cases that are 16 and 17. So it allows for that more community focus and that hands-on support that we can offer. Now, the way that it works is that Ashley and I do operate for the entire region of Durham. So we only hold those cases, and it's split by geographical area. So at any one time, we can have anywhere from about 70 to about 120 youth at a time that we're servicing.
So who is a trusted youth? So as the name suggests, it is a youth with a trustee. So if you are under the age of 18 and receiving Ontario Works, we can't give that money directly to you. So you need to have a responsible adult that's going to accept that on your behalf. So we have an agreement with formerly called the Boys and Girls Club, so now it's BGC Durham now. They act as the trustee for all of our youth. So they will pick up the checks, they'll deposit it into the youth's account. If they don't have an account, they'll find a way to get them the money. And they'll also sign any mandatory forms with them, basically just act as a responsible adult. Normally, you wouldn't be eligible for Ontario Works if you're under the age of 18. So basically, a certain set of special circumstances have to be able to exist in order for us to grant you Ontario Works. We look at it at a case-by-case basis. It could be there's abuse in the household. It could be there's a family breakdown. Maybe the parents don't have the ability to care for these youth right now. We will sit down, we'll have a bit of a chat with them, kind of assess the situation, determine if they're eligible for Ontario Works going forward. They do still have to meet all the regular Ontario Works criteria. We look at their income, their assets, their living situation, just to see what that's like. They have to sign all the mandatory forms, all of that's the same. We do approve their living arrangements. So the reason that they're connecting with us is because the place that they're living isn't ideal. So we'll say, okay, is the place that you're staying now conducive to healthy relationships, to building, a positive living situation for you, and we'll make sure that's happening. Anyone who's in receipt of Ontario Works does have to work towards a goal. So that is also the same with the trusted youth. All we ask is that they're registered and attending school. We do have a good relationship with all the schools in Durham Region, so we'll contact the administration every so often and just say, can you provide us with the attendance for this student? Things happen. These youth, again, are with us for a reason. So there are barriers and challenges that they are facing. So if that's happening and they're not attending school, we have a conversation with them and say, okay, listen, what's happening to you that's, stopping you from attending school? We kind of adjust things based off of that. And they do have to have regular contact with a responsible adult or agency. Ideally, that's going to be us or the trustee through BGC. There's always the potential that they were maybe linked with an agency before they came to us and they feel comfortable with that person. We're not going to make them communicate with us. That's not fair. So as long as they are connecting with someone, we know that they're safe, that they're taken care of. That's all we ask. Sometimes we'll talk to our youth daily, weekly, monthly, but for sure we'll see them every 3 months just to make sure they're okay, see if there's anything extra that we can kind of do to support them, and kind of move from there.
Okay, so now that we've really talked about what makes a trusted youth eligible and what the program is, let's talk about how this change in service delivery is really impacting the youth that we're serving. So first off, it's giving them that low barrier, rapid access pathway to financial assistance. So simply put, we're putting funds in the hands of eligible youth very quickly. So the process to apply for Ontario Works as a 16 or 17-year-old is much more streamlined now that we have the Trusted Youth program in place. The next point talks about the connection that's immediate for the Boys and Girls Club, or BGC Durham, and easy access to monthly checks. So again, that sometimes presented a barrier before the program started, was that youth had to find somebody in their own life that could act as a trustee. And sometimes they didn't have somebody that could fit that role. So a trustee would have to be over the age of 18, responsible adult, no conflict of interest, and somebody the youth ultimately could trust with their money. So if they didn't have someone in that role, potentially they're not coming to apply. So we're really happy to have that partnership in place now because it gives them that responsible third party to connect with. BGC Durham also utilizes direct deposit for our clients. So previous to the program, the clients would have to manage a check, which sometimes is a little tricky for a 16 or 17-year-old. So we're happy that they can get the funds directly into their bank account now. The next couple points, we really talk about individualized service planning. So Ashley and I throughout the program are really identifying that these clients are each individuals and there's not a one-size-fits-all approach to support and success. So we remind ourselves of that when we're working with these clients throughout the program, and we're giving them, again, as much choice and as much voice as we can as a part of that planning process for the future, instead of us simply saying, this is what you need to do. We know that Ontario Works has very clear-cut guidelines, especially with this age group, about how we have to support and serve them and the requirements that need to be met. So the more active a youth can be in part of that process and a part of that planning, it's better for the youth instead of, again, telling them what they need to do. We also have the flexibility in meeting times and locations. So another change with the program is that we don't actually have the youth come in to access service to our offices. So we can meet them where they're at. So we're able to go into schools, to their houses even, coffee shops, libraries, whatever it is that's going to make them most comfortable. And then finally, the ongoing additional benefits to support youth in their participation. Ashley will get into this in a little bit more detail, but I just wanted to share it is an important point because this is in addition to the monthly assistance that they're receiving, the basic financial Ontario Works, and that is crucial to their success because they don't really have that parental support financially that they can rely on.
So regarding the ongoing support for our clients that we get, so as soon as they're approved for Ontario Works, they start to get their basic financial assistance. So I'm not sure if anyone knows what those rates are. It's $343 for your basic needs and a maximum of $390 for shelter costs. They'll also start to get obviously attached with the trustee from BGC and with us and get those kind of supports. That's also the amount across the board for a single person getting Ontario Works. They will start to get some ongoing benefits. So above and beyond, again, that 733, we would issue $46.90 for a Presto. We'd give them the card so they have unlimited transportation, and $50 towards their cell phone bill. So obviously we want to give them those. We don't want to have them have any more barriers than possible. We want them to be able to communicate, to attend school, just help with those ongoing things. Winter clothing allowance. So once a year, we would issue $100 around November just to help out with that. So, I mean, if you're leaving your house in July, the first thing that you're thinking about bringing is not your winter coat and your boots. We also have newcomers to Canada. They might not have winter coat and boots. Teens tend to grow quickly. We want them to be able to be appropriately dressed in the wintertime. Funds issued directly to education and employment. So this is a big one. Let's say you are applying for post-secondary. I'm not sure if anyone knows those fees are not cheap. Once you are accepted, you have to pay a seat deposit fee. That's on top of that as well. So we like to be able to help out with that. Same thing with high school. So if there is a fee associated with your course, if you want to go on a field trip, anything like that will also help with those as well. Employment related things. So if you get a part-time job and your boss says, you need to have a uniform and non-slip shoes, well, we can help with that. If you need to have a smart serve, a driver's license, anything that's directly related to employment and education, we don't want to make these youth have any more barriers regarding that. So things that a normal youth ideally would be able to get some support with, these basic teenage needs, we want to be able to help with that. And anything related to social inclusion. So when these youth are coming to us, they're coming to us because they've had a breakdown in some type of relationship. We want to be able to help them build these positive relationships and healthy relationships. So anything we can do to foster that, we want to be able to do, whether it's issuing a recreation voucher for them to take part in something with the city of Oshawa, giving them money so that they can go to prom, which seems a basic thing that a youth would be able to do. If a prom ticket's $100, you don't want to be spending that. To join a school team, anything that's going to help foster those relationships, we want to be able to help out with. That being said, as of this month, we are no longer issuing those ongoing benefits. So the cell phone and transportation we're not able to issue anymore. So that is because of a change on the provincial level with employment services transformation. So that funding at this time is no longer available. That is massive. These youth rely not only on the supports that we provide in terms of community supports, but those additional funds to be able to survive. Again, that rate is $733 a month for one person on Ontario Works. It's just not enough. We don't want these kids to be having to choose between eating 1 month and working towards their post-secondary employment goals.
So we're going to move on quickly to talk about some partnerships that we have in the community throughout the program. So we do already know that we have that partnership with BGC Durham, who act as trustees for our youth. Again, that's huge. And then just wanted to note that in their day-to-day roles, they are youth outreach workers and youth justice workers. So they are really embedded within the community to support our youth already. So it's a great connection to have for them. We do have some of our youth that will intersect with the youth justice system. So we do connect regularly with probation officers and other justice workers as well, just to make sure the youth is getting supported and getting all of their requirements and needs met across all programs. And we're working together instead of working separately. Probably one of the biggest partnerships we have is with secondary schools in Durham. So Ashley and I are very fortunate to be able to work within secondary schools within the region. We're talking to them pretty much on a daily basis, just in terms of coordinating with these youth about their success planning, any issues that might come up. So the schools have been great in including Ashley and I in that conversation to make sure that we offer that wraparound support and the youth has that advocation for them. Next, we have weekly on-site visits to the youth shelter run by Durham Youth Services in Ajax. So Ashley and I go there once a week, and we will meet with any of our clients we might have residing there, any new clients that might have questions about Ontario Works, and then we educate the staff on our processes as well so they can better support the youth they have residing there. And then finally, we regularly do presentations like this to other community agencies just to build those strong partnerships. So a lot of the times these youth are intersecting across several different areas. So we feel that it's super important to build these partnerships as workers because they're all of our youth in Durham Region. So the stronger we are together, the stronger support team we're going to be able to use for our clients.
So we would like to consider that our program is very successful, but here are some examples. So education, a lot of the youth that are coming to us might not have even thought that getting their OSSD would even be an option, let alone going to post-secondary. So in 2022-2023, we saw 27 youth graduate from high school. 17 of those accepted post-secondary offers, 1 began a trade program, and 9 were supported entering the workforce. So pretty good results. This year, we have 46 youth that are eligible to graduate based off of their age. So that doesn't necessarily mean that they're going to be graduating. Things happen. They might have to come back for a credit. They might choose a different path in terms of post-secondary, need to upgrade something. But we have 46 that are eligible to be graduating in June. Employment. So obviously we want to try and promote employment. Out of our 70-person caseload right now, we have 14 youth that are employed. So that means they are attending school full-time and also are managing part-time employment. Again, we went over the rates before. They're not getting a lot of money through us. So that additional income is so necessary for, you know, those extra things that they might want to do, or even some of them disclose to us that they're saving it for their own post-secondary. So we definitely love to see the employment piece. Health. So once they are connected with BGC, they at their core are youth outreach workers, which means these youth are going to be connected to some form of wellness supports. So most youth don't have to worry about finding a doctor or dentist. Like I know I didn't have to find my own family doctor or dentist when I was a teenager. The health field isn't an easy one to navigate. So we will help those youth be able to be connected with those health supports, which is very important. During the pandemic, we connected roughly 30% of our caseload with additional mental health supports that were necessary during that time. And then Mackenzie's just going to talk a bit about housing.
So I think we can all agree that housing is a huge goal and a huge factor in terms of success for anybody, but let alone for our youth. So we know that if housing is not stable, then we are going to have a hard time stabilizing these youth in any other area of their lives as well. So just a couple notable things that we've done in the past couple of years to help with this piece. So one is that we advocated for the creation of the youth by name list in Durham Region. So prior to the pandemic, this was not something that existed here, and we were finding that there was an increasing population of youth that were homeless with very limited supports that were available during that time. So we were able to collaborate with members of our housing support team, as well as some external partners to get that list up and running. So in order to be added to this list, a client would have to connect with a coordinated access point in the community in order to have assessment done and be added to this list. Now, we were able to get BGC Durham included as one of those access points, so it means it's a seamless transition for our youth if they needed to access that they could do that because they're already connected to BGC as a trustee. BGC has also created a Housing First for Youth program as of 2020 and received regional funding in order to do that. So what that program is it connects a dedicated housing worker to a youth that is on our caseload. So they have an eligibility criteria of being a trusted youth, and they will be connected to help find and maintain stable housing and then work on life stabilization goals as well. So that was huge. So it's our clients that are getting access to their program. And since that program was created, 30 of our youth have been served, and that program also comes with a housing subsidy as well that helps in the search for stable housing.
All right, and then just the remaining 3 measures of success that we're seeing. So financial empowerment. We want to make sure that these youth are financially literate. So out of our caseload, 95% we have made sure have open and active bank accounts. We are very lucky. BGC has actually made a great working relationship with Scotiabank. So if one of our youth comes in with a trustee, they will let them open an account with limited ID, which is very helpful. On the subject of ID, when we first meet with them, we'll ask them, what do you have? We want to make sure that these youth have as much ID as they possibly can. So birth certificate, photo ID card, Healthy Smiles card, SIN, anything that's going to make their lives easier. And then on the topic of SIN, we recently had a partnership with Service Canada, where one of their representatives came into one of the high schools and assisted a few youth with obtaining their SIN. We also focus on social inclusion. So again, I talked about that a little bit earlier. Whenever we see these youth building those positive relationships, we see that as a success, because again, we're only in their lives until they're 18. So once we're gone, even if we have built those really good relationships with them, they need someone else to be able to rely on and to make sure that, you know, their future going forward, they have those supports available to them.
So we've chatted a lot about successes, but we know that there's always some area for growth in the future. So we'll talk a little bit about challenges now. So first off is limited shelter space and lack of affordable and available housing for youth. So we have lots of shelters in the region kind of targeted for adults, but one specifically that is intended to service 16 and 17-year-olds with limited space. So right now, shelter beds are filling up quite quickly. So if a youth doesn't have the availability to get a bed, they're potentially going into homelessness, accessing a service that's meant for an adult, or being in an unsafe situation. So we don't love to see that for sure. Next is the affordable housing piece. And again, this is not a challenge that is specific to youth, but as you can imagine, in this market right now with looking for housing, 16 and 17-year-olds don't have much of a competitive advantage there. So we are working very, very closely again with our community partners to give these guys a leg up as much as we can in order to help them find that stable housing. Limited support for youth in North Durham. So this one I just want to speak directly about the trustees. So one of our limitations with BGC Durham is that they cannot support our youth that are living in the north. So right now we are still relying heavily on those family and natural supports in order to make sure the trustee criteria can be met for these clients to apply. And we work very closely with them to try and brainstorm options just to make sure that that's not a barrier. Again, wait lists for health-related supports. This is not another challenge that is specific to youth, but I felt it was important to note because these youth really do need adequate health care, especially when they're at that transitional age and they're still growing. The breakdown in family relationships causing barriers for youth to access required documents and services. So as Ashley mentioned, sometimes when it comes to the ID, these youth aren't coming to us with their ID. Sometimes they're not able to get that, or it's been lost, or something's happened along the road. So it can prevent them from doing basic things such as opening a bank account, getting a job, or even registering for school. So we need to work very hard in order to do that first before we can do some of those other things in order to set them up for stabilization. The other piece of this is when you're a youth attending school, I'm sure a lot of you in here have signed permission forms for the youth that you're involved with. So we do have to advocate for our youth so that they can still access things like going to prom, even accessing social work, or participating on a team or going on a trip. So we don't want these youth to be excluded from that simply because they're living on their own. And the last one is lack of youth-specific service hub that meets youth where they're at. So again, since the pandemic, I think the region has been very successful of opening some hubs here in order to support adults. However, we don't have one specifically for youth at this time. However, some good news to report is that we are in the early stages of discussions to figure out what this might look like for youth here in Durham. So next, we're just going to share some community feedback about the program. So on the left, there's a video here from Durham Alternative staff in Oshawa that we'd like to share. Hopefully we can get that played because I'm not sure how to do that with the clicker. Maybe. Hovering over it? Oh, I definitely did something. I'm just going to stop. Yeah. Oh. I think it's the other one. Yeah, it's the picture just on the left side of that slide. Yeah, so we can talk about this while we get the video going. So this here is an article that you can read on your own time. We just wanted to highlight it because it was written by Away Home Canada. So this is an agency that does consulting and training on Housing First for Youth programs and really reimagining solutions to youth homelessness. So in the article, they've identified what we're doing here in Durham with trusted youth as a best practice and just sharing information about how we're doing things differently to remove barriers. So it was a really good article if you wanted to read that on your own time. And here's our video.
And we have Nicole Rands, who is our head of guidance here. Good morning. My name is Andrew Liu. I am the vice principal of Durham Alternative. And we have Nicole Rands, who is our head of guidance here at Durham Alternative as well. And just want to talk to you today about the Trusted Youth program and the support that they provide us. Mackenzie and Ashley are usually our first point of contacts when any students have any questions or they need support, especially when it comes to housing needs. They might have some basic financial questions, and it's a quick and easy way for them, for the students to come in and get that kind of assistance. And by Mackenzie and Ashley coming to the school, that's a huge benefit on us. It's really convenient. And Nicole?
Yeah, it's been very helpful for me within this guidance role to have the connection of Mackenzie and Ashley for students who come to me for support in a variety of ways. Students who require extra funding for bus transportation, for continuing the use of their cell phone, for applications to post-secondary. When they are connected with Mackenzie and Ashley, it's a very smooth transition for these students in order to access supports and to get the services that they need in place. And it's extremely valuable for continuing these students' success, not only while they're with us at Durham, but also when they graduate and move into their next phase of life.
Is that right?
No.
You want to leave?
So we think our program's pretty great, but we do have some other youth-focused programming within IEHSD. So first we have LEAP. So LEAP is a provincially directed program for young parents between the ages of 16 and 25. So it focuses on learning, earning, and parenting. Basically very similar supports and processes that we would have. Very hands-on, have great knowledge about youth-related supports in the area. We'll also provide any supports related to being a young parent. And again, it's just a very important program because it's breaking the cycle of poverty, not only for that youth, but for that child. So very important, very great program. And we also have REACH. So REACH is an employment program for any youth who are 18 to 24 receiving Ontario Works, wanting to get a little bit of employment and education kind of guidance. It is very helpful in terms of what we do because we can give a bit of a warm handoff. So our youth turn 18, we say, okay, it's time for you to be working with someone else, and we direct them to REACH. Again, they provide very similar supports and resources that we would, which is super helpful. And again, just working towards being independent of Ontario Works. So a new pressure for REACH right now, as I mentioned that employment services transformation earlier, that is also impacting this program. So that means that the employment supports are now going to be available through Employment Ontario agencies and not through us. So we're kind of working to develop this program so that we're not necessarily doing it ourselves, but collaborating with those agencies so that we're making sure that these youth continue to be supported, but still following those new provincial directions.
That wraps up our presentation. So thank you so much for taking the time to listen to us today. We really hope that you've gained some valuable knowledge about how we're doing things differently in terms of really making meaningful change for these youth and helping them to break the cycle of poverty at a very young age. We acknowledge that they are coming into Ontario Works at that very young age, so we want to see them supported as best as possible in order to see them move forward and achieve success in their lives. So on that last slide, you'll find our contact information. So it's there for your access if you need, and then we are ready to take any questions that you may have.
Thank you very much for your presentation, and we do have some questions for you, starting with Mayor Carter.
Good morning, Madam Chair. Thank you very much. Ashley and Mackenzie, thank you for your presentation. Lisa, good to see you this morning, and good morning. Real fast, because I know that my colleagues also have a whole bunch of questions. You speak about the youth that you're serving between 70 and 125. Do you have a geographic breakdown in regards to where those youth are?
I was anticipating this question, but we don't right now, but we can get those numbers for you.
Okay. All right, great. I picked up on something you said there in regards to helping with finding proper shelter. And to my understanding is there was the Ontario Works benefit is $733, but $390 is just for shelter. How do you find places for $390?
You don't.
Okay, so where does the gap get filled then?
So we understand the $390 obviously is very low, and like not even for youth, but for anybody, I think, that are trying to find housing. So a lot of the times these youth have to dip into that basic need. So even though it's 343 basic needs and 390 for rent, it's all together in one, and they can utilize some of those basic needs in order to find a place for shelter. Again, not ideal, but it's the reality of the climate that we're in right now.
Okay. Do the youth have the opportunity to be able to be employed and receive benefits at the same time? And is there a capping in regards to income that they're allowed to make?
Yeah, so you can definitely work. Like I said, we have that handful of group of youth that are working. As long as you are under the age of 18 or in school full time, you could make as much money as you wanted, and it wouldn't impact your eligibility. So they can continue to work. We can continue to support them with the job search, but it won't impact their eligibility with us.
I'd ask you about the provincial cuts, but I think that would be unfair because that's more of a political question. I do want to ask both of you, this is a unique program to Durham Region. Is other regions doing this type of work? And is it my understanding it's been in place since 2017? Okay. And it's unique to Durham. Is anybody else, any other region doing this work?
So I can't really speak to what other agencies are doing right now. Prior to the pandemic, we were lucky to attend actually a conference, and there was a lot of conversations about what different agencies were doing and what regions were doing. And we were finding that it was a surprise that we were doing this, but this would have been a couple years ago now. The reason why we're doing it, I think, is because we've identified that as a gap here in Durham, and then wanted to do what we can in order to support our youth here because we want to see them be successful and break that cycle.
Are our numbers higher than Mackenzie? Are our numbers higher?
Compared to other regions, I don't have that data either.
Okay. All right. I see Lisa going like this, so I'm going to say
And then
no.
I was just going to say too, so in terms of us doing this program specifically, if you did go through and read that Away Home article, it does actually say that they wrote it and included us in it because in general, Durham actually is at the forefront of being creative in terms of social services and supporting the people of Durham.
So that leads me to the next question, which is, what have you two learned out of this experience? And the reason why I ask you that is because your learnings could be shared with OW that could also take some of your learnings in regards to helping those individuals over the age of 18. So what have you learned out of it?
I mean, it's definitely very humbling realizing that, I mean, if anyone listened to our numbers, knowing that this population exists that might not have been serviced before. I also have learned how uncool I definitely am because they tell us that all the time. But it's just a matter of realizing that, you know, this population exists and knowing that especially as we evolve as, you know, Durham Region Social Services, especially with everything that's happened lately, we've had to be more creative. So it's nice that, like Mackenzie mentioned, you know, we can meet these youth in schools in the community. It just seems like something that it just makes sense to be able to do with our adult population going forward, is not asking people to come into our office maybe because it can be intimidating, maybe offering the ability to meet people more in the community.
All of us have heard the horror stories of, this is a wonderful thing that you're looking after, but the horror stories of 18-year-olds. So your program helps individuals up to the age of 18. Who looks after the 18-year-olds?
So our program runs from 16 and 17, and there's a bit of a leeway that we have. So for instance, say a youth was like in the middle of finishing high school and turned 18 in January, we would still keep them in order to transition them kind of in the summertime. So in the summertime when someone turns 18 is usually when we make those decisions about where an 18-year-old is going to go. So we do have programs in development within IEHSD right now where there's another specialized worker now, which was new to us over the last couple of years because we were noticing that gap as well. Because when you're 18, you still need that support, right? So we have done an IEHSD, created another caseload, which is like another transitional step for those 18-year-olds to get that hands-on support and then further work towards that independence and success.
Are you working with the post-secondary educational community in regards to creating a white paper or data collection, or working with AI in regards to helping with your particular file?
So I was here for the funding question, but I will jump in on the data question. So in the last sort of 20 months, almost 2 years, we have really started to develop out what we're collecting data on and how we're using that. So moving into partnerships with post-secondary and looking at branching out our research opportunities within the Income, Employment, and Homelessness Supports Division is definitely a priority action that's on our list of things to do.
Because you're on the microphone there, Lisa, is there any trends that are that you're seeing that are concerning in regards to either, you know, gender numbers or first generation Canadians, or like, are you seeing something that's really causing you kind of one of those moments to kind of catch your breath on?
I haven't looked at the data in relation to like cultural
Yeah.
and like sort of diversity overall. So we could look at those statistics and give you some information in the future.
I appreciate the work, Ashley and Mackenzie, you're doing. And Lisa, thank you very much for your support. I know that Ms. Austin has played a significant role in your lives in regards to preparing both of you for success, but I really appreciate the work that you are doing. And the youth component of housing, I think we're excited about the Refuge 27 apartments, and then part of their programs that'll be available this year. I'm confident of that this year. So I think that might be part of the solution as we move forward. But thank you very much for the opportunity to meet both of you, and thank you for the work you do on a daily basis. Madam Chair, that's all my questions. Thank you.
Thank you, Mayor Carter. Next, we have Councillor Brenner.
Thank you very much, Madam Chair. Through you to our presenters, and very informative. For a minute, I thought you were going to do the all 87 pages, but I was ready. I did want to ask you, and it's not to harp on the provincial cuts, but did I hear you say that the transportation component has been removed?
So what has changed is there's a shift with the social assistance modernization and employment services transformation. There are numerous shifts in the way we fund and our budget allocations related to the transfer payment agreements. So we are looking at that and finding ways to fill the gap. There will be some innovative and creative moves towards potentially that winter clothing and winter clothing drives that occur and items like that, where we can reduce our resource payouts and look at mandatory payment, like where there are more mandatory needs related to transportation and cell phone. Right now, we are in the first month, so January 1st was our employment services transformation implementation shift. And so working through that funding and moving into the end of March budget, regional budget approval process, we are now really looking at what funding was removed from those components of Ontario Works on January 1st, what is being picked up in our employment services system, which we are also the system manager for, so we have that ability to collaborate and work together really well on that. So we are looking at mitigating the issues that are arising with benefits that the youth and all of our OW recipients received in the past.
So the Presto cards that we provide, will they continue to be provided, or was that one of the ones that got chopped?
So transportation can be offered through Ontario Works for specific types of appointments and areas that meet that mandatory benefit. We have been offering that under other benefits that have come to us through the MCCSS flow of employment services support dollars. So there are a number of funding areas that we are working on mitigating and supporting. But we do have options, and we are working on that. We are going to bring another presentation to you in February that speaks to overall employment services transformation impacts and how social assistance modernization is moving forward. So you'll get more information at that meeting.
So moving it a little bit closer to home, but still focusing on the transportation and the assumption that Presto cards will still be available to be able to get those that need the service to where they need to go.
Yes.
I wanted to ask a question, as I said, more closer to home. Recent cuts to Durham Regional Transit and some of their bus routes right across the region, how are they impacting this particular client base, given the fact that we're working with the youth to get them to post-secondary, we're working with the youth in terms of part-time employment, we're working in terms of getting access to services. With the recent changes, has there been any discussion, did DRT reach out to any of your areas to get input and feedback prior to slashing the routes that they have slashed effective January the 1st?
Through the chair, we work really closely with Durham Region Transit to support vulnerable people across the region. in conversations, it's usually user usage that changes. But they still have active, they have the bus program where you can call. I know they don't like on demand. Yes, I always want to say dial a bus. That's not the right line, but it's on demand service. So that is available for people who are a little bit more scattered. But Durham Transit is one of our closest partners in supporting our clients right across the spectrum.
I'm sure that the communication is there, and I don't want to
Yes.
harp on it, but what I can tell you is that there is a problem, so serious that it is going to the Accessibility Advisory Committee, City of Pickering, because of that problem, and that the youth in the programs that you're talking about, I believe, will be at risk and are at risk to be able to get to where they need to go. The on-demand does not fill that gap, but we can talk offline. Thank you.
Thank you.
Thank you for your question. Next is Councillor Schumer, online.
Thank you very much, Madam Chair, and thank you very much for this presentation. I'm trying to go through and make sure I'm not asking the same questions that have already been asked, but I will follow up on Mayor Carter's question with regard to the stats. Am I correct? 78 to 125? Is that what I heard? As far as
Yeah, so it's anywhere
Youth in the system.
between 70 to about 120 we can range from.
Okay, and I understand you're going to forward some of the maybe geographical breakdown to members of council. Could you give us some history as well? I mean, obviously you've been doing this for a number of years. It would be interesting to see the history as well in those stats. Can you just elaborate exactly on how the youth get into the system? How do they get in? Because I can only think that this is a very difficult part, and it's obviously the beginning part of the process. Can you just elaborate on how these youth get into your program?
Thanks for the question. So are you inquiring me just about like the referrals of where they're coming from, or the actual process once they like get in touch with Ashley and I?
Well, obviously they get in touch, but I mean, okay, so there's a youth out there right now, 17 years old, 16 years old, doesn't know anything about you, but is having these kinds of problems. So how does that youth get caught and brought into this?
So throughout the presentation, we were talking about those partnerships that were being made. A lot of the times within Durham, Ashley and I are doing presentations and connecting with various agencies where the youth might be intersecting. So right now, a lot of our referrals are coming from school. So the youth might be presenting in guidance or to a social worker or something like that who knows about the program, who will give our information. So we can go and have informal conversations about what something like an application for OW would look like and what supports can be offered. We've seen referrals come from word of mouth as well, and again, other different agencies. So if the youth is connecting in any other way, our system or our program is pretty well known through Durham Region and the youth serving agencies. So a lot of the times it's coming from other partners.
Okay, so say it's at a high school, the guidance counselor may give the youth your information, but it's up to the youth to initiate that communication?
Yes, absolutely. So the youth would have to contact our intake center themselves. They can call with the support for sure, but it cannot be somebody calling to initiate and start an application on their behalf. It has to come from the youth.
Okay. You mentioned, I think it was on slide 8, very first point was that some of the youth are making use of existing shelters, which are designed more or less for adults, and you don't like that. I think you used a phrase, an unsafe situation. Can you just elaborate on that?
So the adult shelters for sure, that would be a better situation than being somewhere unsafe. But when I'm referring to somewhere, a situation that might be unsafe, is it might be potentially their only option is to return home. And home we've identified as an unsafe place. Or perhaps they're staying with a friend and that friend's family might not be stable. Just somewhere that's not as stable as potentially, either being in the youth shelter and having those youth related supports involved or being stabilized somewhere else. So when I refer to unsafe, that's what I mean. And definitely the adult focused shelters, that would be more ideal. But ideally we would want these youth connected to the youth serving agencies who are going to be able to offer the support for that age group.
On that same slide, you did mention about the limited support for North Durham. As a counselor for North Durham, can you elaborate on that? I know you were trying to go through this presentation rather quickly, but can you elaborate on the challenges that you're experiencing, particularly in North Durham, and what we're doing to address it?
So for North Durham specifically, I did want to speak about that trustee piece. So it was just a limitation through the agency we work with, BGC, who cannot support youth in the North. So we're definitely open to looking at other options for partnerships in North Durham that might be able to act in that role. But that's mostly the challenge, is that we wanted to add this contract for BGC to mitigate that issue of the trustee having to be a family or natural support, because we know sometimes that can break down, and sometimes it's not an ideal situation when it's not a third party that isn't emotionally invested with the youth. So I think it's more the trustee piece, and definitely looking to build more partnerships up there to see if there is opportunities that we can develop that.
Okay, when you mention North Durham, are you saying this challenge is happening in Scugog, Uxbridge, and Brock, or is it a specific municipality?
It's Scugog, Uxbridge, and Brock, yeah. So BGC Durham is more down in the south area, so Whitby, Ajax, Pickering, Clarington, Oshawa. So yes, it's all three that you mentioned.
Okay, thank you. I guess lastly, so following up again on Mayor Carter's questions to you. I mean, this is a fairly unique program with respect to Durham Region versus the province, and outside, of course, of the funding that goes through to the youth. So I take it then the complete operating cost for yourselves is borne, that's completely through the region?
Through the chair, no, it's not. So Ashley and Mackenzie are case coordinators who have caseloads that are made up of those trusteed youth. They operate the program on different principles and support sort of guiding principles on how we wrap around services and work with individuals in Durham, and that's applied to the youth program. They are case coordinators that are funded under our OW portfolio.
Okay, so it's not just OW funds going down to the students, it's OW funding some of the program itself.
So through the chair, yes. So it's just us as the system lead for OW in Durham, ensuring that our youth are well taken care of in a unique and creative way within the parameters that the province has laid out, and really making sure that we're trying and we're aiming to break that cycle of poverty for those youth.
Okay, it's interesting. I don't know why the province would I mean, through OW, essentially provide the assistance and then, not have it throughout the rest of the province. It seems like an excellent program. It just seems like there's a lot of holes throughout the rest of the province. Would that be a correct assessment?
Through the chair. So as system manager in different areas, including OW, we have the capacity to do things uniquely as our community requires. And so looking at the individual needs across communities right across Durham, and then offering the services that fit is part of the role of system manager. And so this is a program that has been developed out based on a need and a gap that we saw in service delivery. We do share it with others, and components of it may have been picked up, but Durham is definitely a leader in its capacity to support youth, and that's our other LEAP and REACH programs as well. It's really looking at and committing to how we break cycles of poverty across our communities.
Okay, thank you. And I guess my last question, I'm just going to go back to the stat question and the North Durham question. Given that you don't have the same partnership you have in the South, do you have any idea about what could be the issue in North Durham with respect to these youth that are not being taken care of in this envelope because you just don't have the partnership available? Do you have any idea what that number could be?
So Through the chair, I don't have the number of youth on hand for North Durham, but what I can tell you is they are being taken care of through the Trusted Youth Program. We just don't have an agency in place that is offering that that actual direct support that BGC is at this time in the North. So Ashley and Mackenzie, their school board memos of understanding and agreements, they allow them to go into schools in North Durham. They are meeting with students up there. They ensure that the students have the supports in place that they need. There's just that one component that we have additionally in the BGC coverage area that we haven't yet been able to implement in the North. The program started in 2017, and then with the gap in the pandemic, building out innovative programs like this during the time of all of the provincial shifts with social assistance modernization and EST, it's a work in progress. So definitely youth in the North are being taken care of as part of this program. There's just one element of it that isn't in place yet.
Okay, thanks for that clarification. Thank you very much.
Thank you for your questions. Next on the list, we have Councillor Anderson.
Thank you, Madam Chair, and thank you for all the work you do under trying circumstances. And, you know, we have presentations, and some of them I don't really listen to as I should. I find this to be a worthwhile presentation. If you know, I could have worded that better than that. But so, because my focus is always on young people, empowerment of young people and education, without being overly partisan. Youth under, before with families and with income under 50,000 or somewhere there, used to be allowed or have access to free education, post-secondary education, and that ceased after 2018. That would have made your life a lot easier. And I've heard folks come to me, especially from a marginalized community, we would love our son or daughter to get to post-secondary, whether it's college or university, etc., and they can't. When you are approached by a young person, said, "Oh, I would love to go to a post-secondary, but we don't have the means to do so." How do you help them? Where do you transition them to?
Thank you for the question. And through the chair, yes, we will definitely transition them and support them with accessing services that are available. So up into January 1st, until when EST came into place, we were able to support with things like the application fee. And the trustees actually that we work with through BGC, they do several of those a year, so they're very good at them. Ashley and I too, so we can support them actually hands-on with the application process right away. And then when it comes to applying for OSAP, that's an additional support that we can help with once they get accepted. And as Ashley mentioned, we were able to help with seat deposits as well, because those are additional fees that are involved with that. So we're able to still offer that wraparound support in terms of navigating next steps, because a lot of the times the youth will come to us and say, you know, I want to go to college, but have no idea where to even start. Don't know about OSAP, don't know about the process. So within doing this this role, we've become very educated with knowing about how to apply for OSAP, how to make those applications, and certain deadlines to watch out for, so that we can make sure they're supported along the way.
Thank you. And just as a follow-up to what Mayor Carver had asked, I don't know if you have stats. Are most of these young people that you help, are they from marginalized communities or racially marginalized, I guess? Or you don't have that stat?
You have the stats?
Oh, I don't have stats, but I was just gonna say that we I don't know that we have statistics. I'm sure we could pull them, but honestly, it encompasses such a big population. And also, I feel like sometimes people will assume that it is, you know, we mentioned the things that like our special circumstances that you have to meet. So some people will assume, you know, you're from this type of background, or, you know, your parents are already receiving assistance, or that kind of thing. The income levels of the families can span too. So honestly, it encompasses such a big population, and different statistics for all these youth are all so different.
Thank you. One final question. I have a lot, but I'll just stick to one more. I know there are a number of scholarships and grants available that you have to access online. If you go online, you'll see a number of them. And there was an article in the paper once that young people are not accessing these scholarships that are available. Do you provide assistance in enabling young folks to, or help them with to access these opportunities that are available?
Thanks for the question. And through the chair, yes, absolutely. So through BGC Durham as well, they are very well versed in what's available within their own agency as well as outside as well. So we always work to advocate for these youth and try and get them to access as many services and as much funding as possible that's available. So we don't want to leave anything on the table if there's something that might be eligible. So we're definitely encouraging them to apply for anything that's available in the community. And same with schools. So we're finding that within the secondary schools in Durham region, their guidance departments are all very, very educated in what's available, and they are all recommending and supporting the youth with applying for those things as well.
So I did say I didn't have another question, but please indulge me. So do you actually go into this? How do you interact with like guidance counselors in the schools, especially in the high schools?
So in a couple different ways, actually. So it depends on what the youth's need is. So there are so many examples I could give you in terms of how we support with the guidance department. Ashley and I can probably both share that we talk to guidance departments almost on a daily basis, whether that's through email, phone calls, they'll invite us in. So we connect a variety of different ways. And sometimes we'll go and explain what our program is. We can do applications. So guidance will actually invite us into the schools and we'll do applications for youth there. They'll invite us into conversations. So perhaps there's something that's happening with the youth and they might be at risk of being removed from role from school. So they'll include us in that conversation as well to do planning and things like that of how we can support them to be successful moving forward. So there's a variety of different ways of how we're interacting with them, but they really encompass all the areas of what the student is involved in, whether it's concerns, academic progress, attendance, getting them involved in other supports, things like that.
Thank you very much. I have other questions, but I'll do that offline. Thank you so much. That's it. Thank you.
Next on the list is Councillor Crawford.
Thank you. Amazing work. That is such a good news story. Thank you so much. You breezed by the most important part of that whole report, and that was your stats that I couldn't find in the report. So could you email those to me if you don't mind, the success stats, or did I miss them in the report?
So they were sharing success stats that they pull independently from sort of different case notes and spaces. We are building a database that will make that much cleaner.
Okay.
But one of the stats I know that whipped past really quick for the LEAP program is the number of graduates since the program's inception. I think it was 2000. And it's important to note that in that program, we have seen to date, we've seen 1,160 LEAP graduates. That's approximately 50 graduates per year. And, we had 3 years of the pandemic in there, which definitely changed outcomes for high school students and people completing their OSSD. So it's a very successful rate for a community the size of Durham to see young parents making it through and graduating, many of which, and I'm looking over at Lori who supervises the program, but many of which then move on to post-secondary and out to building on financial stability.
Amazing, thank you. Back in February, the federal government gave a grant to the region out of the Building Safer Communities portfolio, and I believe that it was for youth to keep them off the streets. And I'm wondering, I think it was given, please somebody correct me, but I think it was to the Community Safety Wellbeing Committee. Does any of that money flow through this program, or I'm just curious, and does what you do, is it covered under that Community Safety Wellbeing portfolio?
Through the chair. Thank you for that question. It doesn't flow through us directly, but it does flow through the community agencies and partners. So I don't have a lot of detail on that program, but we certainly could share that with you. I can connect with our community safety and well-being team on that.
Okay, yeah, because that was a lot of money that was given by the federal government, if I remember correctly. Anyway, thank you very much for your hard work. I wish I come to more of these meetings because there's so many great things that are happening in the region out of health and social services that you don't necessarily hear about every day. So I'm very, very, very proud of the work you do. Thank you. And I know that this group of people are not always the easiest to deal with because of just varying hormones and different attitudes. So you deserve a medal. Thank you.
Thank you for your question. Next on the list is Chair Henry. Sorry, we can't hear you.
You can hear me now? Okay. Good morning. Great presentation. My question is to the clerk. Procedurally, committee has to give direction to get this to go to council. Do we need to do that in a form of a motion? I think that all members of council should see and hear this presentation.
Sorry, let me just confirm that. So we can do it as a simple motion, asking to present it at council, or we can do it just as a direction, whichever the committee would like to go with.
Well, Madam Chair, I would like to ask if you would give staff direction to send this excellent presentation to council for all of council to see and have the ability to ask questions.
I will do that. Thank you very much.
Thank you.
So we have Mayor Foster, did you want to speak?
Yes, thank you.
One more?
Rapid fire, 4 questions, and yes, no, or we'll get back to you will be wonderful answers as required. I'm making the assumption that the province pulled funding but didn't call you and say we're going to take care of it. This is the Transportation and Communications.
The province is moving through a process of employment services transformation and social assistance modernization for a number of years now, and so clarifying the details is an ongoing basis.
All righty, perfect. So the report that you are bringing in the fall, or should we do something now, advocating on behalf of funding, the youth for this, is there a positive action that we should be doing now?
We are looking at bringing an information report and presentation to you at the February Health and Social Services meeting that will provide an update on social assistance modernization and employment services transformation more in its entirety so that you could think about and make decisions that way.
Might I suggest, as opposed to an information report, they're great, they're educational, but positive action on the part of this, if there are recommendations along with that report that we can pass, and perhaps the lower tier municipalities. I'll leave that thought with you. Second question, we all represent lower tier municipalities. The lower tier municipalities provide rec service, a variety of services that sometimes come with costs attached. Are you engaging with the lower tiers? And are there things that we can do to help the identified youth that are part of your program that, again, socialization and whether it's waiving fees, are we doing any of that work? And if the answer is no, can you get back to me?
We can get back to you with some individual updates, but we do work with all our recreation partners where we can to implement supports and then also offer out any free gym services or things like that. Make sure the information's out there for the students.
Okay, perfect, because we have a role to play. We're responsible as well on the lower tiers. Lastly, do you do any outreach? So our family has direct experience with, I'm going to call them unsheltered youth, and these were friends of our kids. We knew them, great experience. And this is prior to 17, I would suggest. Is there any outreach going on? I've got to believe that our household is not unique. So there are a number of youth that you would be dealing with that are finding accommodation and some degree of support. Is there some sort of portal or some communications that years ago we might have used to say, hey, you can, there's someone out there that will help get you a scholarship or. So looking at possible community providers or individuals that are providing. I'm really not articulating myself particularly well. No. Why don't you phone me and we'll talk?
Okay, that's fine. Yes, we can do that.
Thank you. Madam Chair, thank you.
That seems to be all our questions for today.
Thank you.
And just want to thank you very, very much for the work you do and the community partnerships that you've forged and the trust you've created in the community. You do a wonderful job. So it was a really interesting presentation because there is a gap that we don't often hear about the youth. So thank you.
Thank you very much.
So next on the agenda, 5.3 is a presentation by Jocelyn Siciliano, and Area Manager, Ashley Smith, Supervisor, and Megan Middleton, who's the Supervisor of Income, Employment, and Homelessness Support Division, and it's regarding the Durham Regent Street outreach. Welcome. Thank you.
Thank you very much. Good morning. Thank you for having us here today. A big number of our dedicated outreach team is behind me, some of them just having come off the night shift, so they're a little sleepy. But we wanted them to be here today to be able to hear this. I'm going to introduce the presentation that will be happening, but one thing that I wanted to just touch on really quickly was we did a data poll just from 4 days of this outreach team being out there 24/7. Just some important information that I wanted to share. So from Sunday at midnight to Wednesday afternoon, 109 interactions have occurred with homeless people. 91% of them are unsheltered, so not couch surfing and not staying somewhere temporarily. 22% are 18 to 29 years old, and 70% were 30 to 49 years of age. We discovered that 38% of this 109 are on the by name list. So there's a big chunk that aren't. And now that this outreach team is out there and is an access point, we know that number is going to increase and it's going to be a lot more accurate going forward. We've had referrals from many different places since we started. So bylaw, hospitals, shelters, Durham Transit we've been involved with already. It's just incredible, some of the stories that have already come out of just 4 days of having this happen. So I just wanted to share that and how important I think it is that if one of these shifts interacts with someone at Lakeridge Health, say, or a shelter, they're able to say that the next shift will be on and can follow up. So we've got that, continuing that hours of service that can happen that we're able to provide that wraparound that we weren't before. So it's really having a big impact already, and we're hearing positive things. So I'll let these ladies take it away from here.
Good morning, and thank you for the opportunity to present to you today. We'd like to begin today's presentation by introducing ourselves. We are the supervisors of Durham Region's Regional Street Outreach Program. My name is Ashley Smith, and this is Megan Middleton. Today, we're going to look at the region's newest homelessness initiative. We will review the history of how the team began, review the engagement model, explain the services the outreach team will provide, and how they will play a crucial part in supporting the unsheltered community members move through the street outreach continuum. So the point in time count, referred to as the PIT count, captures a snapshot of individuals experiencing homelessness over a set period of time. In Durham Region, the count gathered information on the number of persons and families experiencing homelessness within a 24-hour period on October 20th and 21st of 2021. The count found that at least 573 individuals experiencing homelessness, with 40% who were experiencing unsheltered homelessness. The vast majority were located in Oshawa and Ajax. So this may be attributed to the fact that those communities have the hubs and services to support unsheltered individuals who are experiencing homelessness. The discrepancy between the number of, we know that our by name list currently has 360 actively homeless individuals on it, and of this number, 186 are identified as being chronically homeless, which means that they are experiencing homelessness for 6 months or more. So the discrepancy between this number and the people that we have on the by name list, I apologize. The discrepancy between the number of people on the by name list and the number of people identified by the PIT count highlights the need for the engagement team, as they will actively seek individuals who are experiencing homelessness that may not be otherwise involved with other services. So the Regional Council identified a need to increase street outreach programs to ensure appropriate coverage across the region of Durham. The goal is to support the increased instances of people experiencing unsheltered homelessness who are not otherwise engaging with services or supports. So in response to this request, Income, Employment, and Homelessness Supports Division developed and implemented a housing-focused street outreach program. The program addresses the identified gaps in current programs by providing 24/7 support, building rapport, adding people to the by name list, and the connection to vital services for unsheltered individuals across the region of Durham. Oh, I apologize here. Okay, sorry. Yeah, sorry. Okay, so here is our timeline. In May of 2023, Regional Council identified the need for additional street outreach supports. In June of 2023, Durham Regional Transit also identified a need for outreach support on their buses. And in October of 2023, we hired 12 regional street outreach staff. In November of 2023, the staff began their training, and that ended on January 5th of 2024. In December of 2023, warming centers across Durham Region began to open in response to colder temperatures, and a warming center was initiated at regional headquarters in LLC. The outreach team began supporting this space on a daily basis as well, so just meeting with individuals as they left LLC. In January of 2024, the outreach team began working on the road, and so that was January 7th. We had our first day, so this was Sunday that just passed, and additional outreach workers are going to begin to join the team as well. We just hired another couple of them who will start at the end of the month. And in February, we will do a program review to see where we are. So street outreach is a professional intervention that is actively in the field. It interferes with the trajectory of each person's homelessness by trying to bring it to an end, and it persuades people who are unsheltered to accept offers of assistance with housing while meeting immediate needs. Durham Region's Street Outreach Program is an engagement team who seek people experiencing unsheltered homelessness with the goal of developing trust, meeting their basic needs, and ensuring that people are connected with Durham's by name list and coordinated access system. The Region's Street Outreach team consists of 12 trained staff who are able to problem solve, mitigate issues, and respond to service gaps. The team focuses on continuous improvement of service coordination and navigation of the individuals they are supporting. The outreach team will assist with housing readiness activities in order to remove common barriers for an unsheltered individual to secure housing barriers that an unsheltered individual may come up against, such as securing identification, a source of income, and financial literacy, so filing their taxes, getting them paper ready so that they can look for housing. The outreach team is committed to community wellness and building strong relationships with businesses, residents, and human service providers. The goal is to build trust and confidence between stakeholders through ongoing dialogue and improved access to coordinated services. As I previously said, Durham Regional Transit had identified a need for street outreach workers on their transit system. So, Durham Region's DRT identified the need requiring outreach. Sorry, Durham Region identified the need for the outreach team. And what they have identified as their need is that they would like us to survey their bus shelters, provide alternative options to individuals engaging in extended bus rides and residing in their bus shelters. The goal is to have the unsheltered individuals relocate to more appropriate locations, as transit is for the purpose of transport. The outreach team will provide support with the following incidents and issues. So individuals residing in bus shelters, extended bus rides, altercations on the buses, and altercations in the bus terminals. So it's important to note that this team is not an enforcement team. We would not be removing people from the buses. However, we would be supporting them and giving them alternatives. So if they were utilizing the bus for extended bus rides as a means of safety for overnight, we could refer them and help them get to one of the warming centers throughout the region. So the way this will happen with Durham Region Transit and the outreach team is Durham Region Transit will contact the outreach team, provide them with as much information as possible, such as the location of this individual, their physical description, the time, that sort of thing. Outreach will then respond and offer supports. Okay, so this is the street outreach continuum. So there are 3 distinct areas of support along the street outreach continuum. The first is engagement, which focuses on seeking unsheltered individuals, adding them to the by name list, and working on housing readiness. The second is the intensive case management, which focuses on critical life stabilization supports. They receive their clients from Durham's by name list, and they will then tailor their approach to the individual's goals with a focus on housing. The third is housing retention case management, which focuses on clients being able to maintain their housing, enhance their life skills, and address their unique barriers. It's important to note that this is a continuum, it's not linear. So people may move forward and backwards on this continuum, and they will be supported at each stage. At no point would they be discharged because they fail to move forward. So using an engagement model that is grounded in trauma-informed care, anti-oppressive and harm reduction framework for understanding poverty, and through motivational interviewing, staff from the Regional Street Outreach Program will create authentic relationships and use assertive engagement to reduce homelessness in the region of Durham. The outreach team is contact-driven, which means that they are going into the community and actively seeking and looking for individuals that might not be otherwise interacting with the services that we currently have. They're also involved in assertive engagement, which means that they are talking to them about their basic needs, but also informing them and educating them on the services that are currently available within Durham Region. Our outreach team is also an access point for the by name list. So that means that once somebody is consenting and wanting to be placed on that list, they would support them to do so. So that might take quite a while to be able to do, but they would continue to plant those seeds and make those connections with that individual in order to get them to trust us and eventually go onto that by name list. Once they're on that by name list, the outreach team will support them with becoming housing readiness. So a lot of the individuals that we are encountering do not have simple things that we might take for granted, such as identification, birth certificates, SIN cards, having a source of income, having a support system, having a doctor. They will help them to make sure that they are ready to hit the ground running once they are involved, once they get pulled from that by name list, and can then work with that intensive case management. So we're hoping that will help with the flow.
So we did speak about assertive engagement in the last slide. We just want to pull it forward because this is our main principle that we're working from as an outreach team. So it's important for our team when we're engaging with folks that we're honoring their choices. We can never be in a position where we're placing our goals on them. It has to be meeting those clients where they are in their journey and recovery path, and really leaning into moving forward on what it is that they want to work towards. We're also engaging individuals in making informed decisions. So rather than providing them with a bunch of options and saying A, B, or C, really detailing for them what encompasses that decision. So what are you considering when you're leaning into making that decision? Also flexibility. So if an individual is not wanting to engage with us the first, second, third, fourth, 10th time, really being flexible and saying, I understand you don't want to speak with me now. I'll be here when you're ready to speak with me. And then direct outreach to each person where they are located geographically. So oftentimes we talk about meeting an individual where they are on their journey, but also geographically is important for us. So again, not having clients come to us, it's not in reach, it's outreach. And because we're going to be supporting across the region of Durham, really going to those clients where they are geographically. And then building relationships through empathy. We are obviously going to be using active listening, but going a little further than that, empathizing with their situation. And then we know that outreach has to be consistent and have a consistent presence in the environment. That's how we're going to build trust. We know that these individuals say, yep, this team's okay, and nope, this team's not. So really making sure that we're out there and we're able to pass that trust torch amongst our homeless individuals. And also outreach is persistent. So we are supporting one of the shelters in the Whitby area. We're going daily, right? Making sure our shift notes are there, going from shift to shift, and just passing the information along and supporting that individual daily. So not popping in here and there, but keeping those promises that we make. And then also identifying the individual's strengths and goals. We're working from a strength perspective. So what is it in that individual that they have a leg up, and really being able to build on those to be able to support their choices that they have identified themselves. So we're just looking at some of the regional street outreach services that we're able to provide. For sure, some water and food program referrals. So we know that it's easier to engage with somebody when maybe we have a bottle of water to offer because they're dehydrated, haven't drank or ate anything in a few days. So if that's a way where we're able to start the conversation, but also not just providing that, but doing some more community mapping. So we don't want to bring all the services to them. We want them to know what services are in our community so that they're able to access additional supports and services as well. For sure, completing the documentation, like Ashley previously mentioned, and facilitating their ability to apply for social assistance, OW, ODSP, but not also those sources of income. It could be CPP, OAS, whatever it is that they're eligible for. Oftentimes completing wellness checks, so just making sure that individuals who are on the streets right now are safe in the space that they're in. And then providing supplies to sustain life. So we often have a conversation about in the middle of the winter when it's cold temperatures, it may be appropriate to provide someone with a sleeping bag, whereas in summer when it's warmer, we're not just going to be going out and handing out sleeping bags. So really making sure that we're paying attention to sustain life. We do not want to make it easier for folks to be homeless. We want to be able to eventually build that relationship to bring them somewhere indoors. We will be for sure making referrals to shelters and transportation to shelters. So we do have 3 regional vehicles. We aren't transporting clients in our cars, but we have a means to access taxis, cabs, bus tickets, whichever is suitable for that individual. We have already done a ton of referrals to shelters and warming centers. So we are having meaningful conversations and getting people indoors, which is great to see already. And we are going to be supporting individuals to develop a housing plan. We know that we are a housing first community here in Durham. There are no preconditions to being able to access housing. Typically what we want to see is they're able to access housing, and then we're working on all of those other pieces that they need to work towards. It's hard to work on those when you're living on the street and not being able to meet your basic needs. Also, we'll be supporting encampment relocations. So in a partnership with Bylaw, if they are in a position where they're dismantling an encampment or relocating folks, we'll be able to be on site to provide them with additional support and referrals. As Ashley mentioned, we are a by nameless access point, so we have the ability to complete those VI SPDAT assessments and have the individuals added to the by name list. Also, too, we are going to have a partnership with, I know most are familiar with it, our MHOP and PCOP team, and we're just going to touch on it here. So just to reiterate, I've watched plenty of these, and I know you are all well aware of it, but our primary care outreach program is our PCOP program. They are working 8 a.m. to 6 p.m. 7 days a week. This team consists of an advanced care paramedic and a social worker, and their goal is to provide outreach, medical care, service navigation, and referrals. And then we have a more new program, the Mental Health Outreach Program, MHOP. They are working 8:30 to 4:30 Monday to Friday, and they consist of, or this team consists of 2 social workers, psychotherapists. Their goal is to provide outreach, clinical counseling, psychotherapy services. So yeah, they started November 20th and they hit the road on they finished training on January 5th. How many ever weeks that is? I am also coming off the night shift, so someone else do the math for me there. Long story short, they were in training for a long time, 5-6 weeks, if not. So they're happy to hit the road. But here we can see an extensive list of some trainings that they were able to engage in. CPR, first aid, crisis prevention intervention, de-escalation training, naloxone training, our HIFIS training, the SPDAT tool to get them on the by name list, specifically the by name list. And also we were able to do, some of these are pending still. Trauma in the brain, motivational interviewing, we still have some that we need to do. Bridges out of poverty, defensive driving. You can see the list there. I think what's neat about our training program is we were allowed or able to provide a lot of these trainings based on what we were able to offer internally, but we also were able to invite some of our external partners to be able to lend their expertise to our team. So for instance, trauma in the brain, we were able to connect with Durham Victim Services to provide that training. So not just in-house, but really leaning on our community partners as well. And then some of the equipment that our outreach team is going to have, they are going to be in full uniform similar to our PCOP team. They will have labeled identified shirts with our Durham D logo on it, as well as pants, coats, hats, safety vests. They will be wearing steel-toed footwear for safety for sure if we're going out into encampments. They'll have backpacks, first aid kits, and also naloxone. There's 2 different programs, but they are able to administer naloxone, but we also have been an approved program to be able to distribute naloxone. So when we're distributing naloxone, we're not just handing them out, but we have the responsibility to provide a short training session to that individual. So substance users, family members, community agencies, whoever's really needing that, but not making sure we're not just handing them out, but we're providing that information as well. We will have the needle disposal containers. They are well equipped with cell phones, laptops. We spoke about the benefits of snacks and water. So they have their snack hygiene kits, puncture-proof gloves, and flashlights, as well as lone worker safety alert devices. And essentially those are just mobile panic alarms. And I know that this is a new program for the region. When Ashley and I first started, we were able to do an extensive research in regards to what other areas are doing. We know that it's not unlikely that we have community agencies doing outreach as well as our own municipal program as well. Toronto, City of Toronto, they have their own outreach team as well as community agencies doing outreach as well. So this is not something new. We're just jumping into it. Our other community agencies who are providing outreach services are Cornerstone, CDCD, North House, and DCHC. We have already been able to establish some additional initiatives to support collaboration amongst the region. We don't want to be doing this work in silos. We want to really be able to join forces and support this community as a whole. So there is the street outreach sector table. The purpose of this table is to help people experiencing unsheltered homelessness to be added to the by name list quickly, supported with immediate needs, be connected with a dedicated case manager, and housed as quickly as possible. We just play the one part in it because there is that full continuum, but that's the goal of this sector table. And as the service system manager, representative from the region will be chairing this street outreach sector table. And although we do have staff from the region who sit on this table, we have also included various external agencies to lend a hand in knowledge sharing. We also have developed some coordination meetings, so the region will facilitate monthly coordination meetings with all street outreach teams, and the purpose of this is to case conference and further develop our services. And the region is also facilitating regular meetings to collaborate and problem solve with bylaw in our lower tiered municipalities. We don't have any lovely stats to share like the Trusted Youth because we started 4 days ago, but we promise we'll get some for you. Definitely we know that with a pilot project, we are responsible to do a program evaluation to show the work we're doing is meaningful. And here are some of our key performance indicators. So we're going to be tracking the number of interactions that we're having with unsheltered folks. We'll be looking at how many individuals were referred to community agencies and or housed, and what those specific agencies and referrals were for, the number of individuals that we have been able to add to the by name list, and then some of our housing readiness tasks, so how many individuals we were able to assist in obtaining ID, completing their taxes, and generating an income source, as well as our program has a focus on the community wellness piece. So for sure, we're supporting our unsheltered population, but we also want to be able to build those relationships with our business partners and support the community as a whole. So we'll be looking at how many street hazards that we were able to intercept and number of individuals that were provided with harm reduction services like the distribution of naloxone. And that is a really big program in a nutshell. Here's our contact information here. I will just let you know again, Ashley and myself, Megan, we are the supervisors of the outreach team, more than willing to converse on an ongoing basis if you have any questions that we don't touch on here.
Thank you so much for your presentation, and the committee does have some questions for you, starting with Mayor Carter.
First of all, good morning, and thank you very much, Jocelyn. Good to see you. The people that are sitting behind you, is this our outreach team?
This is
Okay,
some of them,
so,
yep.
So I've been fortunate enough to be able to work with some of them through the John Howard Society, doing a tremendous job in the great city of Oshawa, and I'm grateful to see that they're having an opportunity as outreach workers, because the work they did in our city was tremendous, and they made a lot of contacts, and I'm very grateful to be able to see them there. So there's a whole bunch of questions, but it's unfair because of the reason that the program's only 5 days old. And plus, there's people that need to go home and sleep. So I want to do that. One of the things that I do want to request is that on the coordinating meetings, is we do a community wellness meeting every Tuesday morning with all my departments at 8 o'clock in the morning. That gives us an update both in regards to overdose calls, interaction with our security bylaw, also in regards to challenges with our business community or residents. It's ongoing. I'm wondering if we could count on you for a monthly, to join us once a month on one of those calls, just so that we can better understand some of the statistics that you've had, and that how it will help us be able to make sure that we've got the right resources in the right place.
Absolutely.
Is that fair?
Sure.
Okay. So I just want to make sure that we put that offer in. Justin, I'll reach out to you and coordinate that.
Okay.
I think a month from now is probably fair, right? I mean, I don't want to bring you bring you into a place. I'll be absolutely honest with you. This is something that we were committed to, and we wanted to see happen a long time ago. I'm just glad to be able to see that the program's up and running, and I think that it's going to make a significant difference. I do want to ask, do we have the opportunity to ask questions in regards to place of origin? And the reason why we'd like to understand that, based upon our experience in the city of Oshawa, is we're dealing with individuals sometimes that are transient, that are moving through and moving back through again. And we'd like to try and figure out how we can coordinate those individuals with the right services, navigate. And in some circumstances, the Backdoor Mission has been successful at asking if they want to return to place of origin, that we're able to provide transportation. Can you try and obtain place of origin information?
Absolutely. That could be something that is asked on a regular basis.
Okay.
Just to determine, yep.
The other things I'm going to ask you, and it doesn't have to be specific, but I'm asking our fire, our police, our security, our bylaw people to do the same. Male, female, approximate age, location where they are, so that we can see if there's things like that. I'm wondering, would that also be beneficial in regards to us sharing that information, both to you, to us, and us to you?
Yes, for
Okay.
sure. And I can tell you, I didn't share all of the stuff that we pulled quickly, but out of the 109, 65% are male
Yeah.
that we interacted with.
That's okay.
Yeah.
And there's a troubling stat out there that I know that your outreach workers will be dealing with this. The identified individuals that are being trapped in human trafficking. What I am shocked at is A, the numbers.
Mhm.
And number two is there is a trend right at this particular time with our overdose calls that we're seeing more females than males on overdose. And that to me indicates that that may be tied to human trafficking, it may be tied to something else. That really concerns me, and that's the reason why I think it's really important, because I think human trafficking is a major concern. I know the outreach workers will be dealing with it. It's such a sensitive issue and a protective issue, and trying to navigate and protect the individuals is so important. So
Absolutely. And we're lucky because Durham Region already has human trafficking response teams.
Yeah.
And we've been doing this work since 2018. I actually wanted to put my hand up when the youth presentation was happening, because when they did allude to some of the risk that youth experience, it does come out of perhaps not having the income source before applying for assistance and being exploited. When you're homeless and perhaps couch surfing, we know that 99.9% of them trade sex for that couch or that food to eat.
Yeah.
And so this is when, that can start. So if you're homeless, same thing. The rates of trafficking are so high among the homeless population because people offer to assist, and unfortunately, the motives aren't always true and positive, right?
that world unfortunately lives in a conditional world.
Yes. Yes.
I do have a question in regards to how are you going to do, it says dedication to community wellness and building strong relationships with businesses, residents. How will that be done? Is our outreach workers, are they, especially in our downtown cores, such as us, Ajax, I know, we have concentrated downtowns where a lot of our unsheltered population and most vulnerable are. Are the outreach workers introducing themselves to businesses and residents in those downtown cores?
I'll let Megan speak to it, but we're also responding to concerns from perhaps community members or businesses who are reaching out to the email address about concerns, but I'll let you.
And I can just speak from experience in the last short couple days that we had. I'm almost positive the last shift note that I read was individuals, outreach staff going to hotspot locations, not finding individuals there, and entering the business and engaging in a conversation with those business owners. And also being able to leave our contact information should they need to reach out, and support is needed.
That's great.
It's already happening.
That's fantastic. I gotta be honest with you. I just absolutely believe in this program. I believe you got the right people in the right place. I think that this program is going to pay huge dividends. On behalf of myself, anyways, and the city, you have my full support. Like I say, I've worked with some of the people that have been hired through this program. They're outstanding individuals. They've shown huge amount of dedication, and I think they're going to do a tremendous job for you. So Madam Commissioner, I'm just telling you right now, well done, okay? Just well done, and let's make sure that we support this team 100%, okay? So thank you and have a great day.
Thank you.
Thank you. Next, we have on our list Councillor Crawford.
Thank you very much. Thank you for your presentation. Amazing again. Thank you. I think, like Mayor Carter said, this is so needed. Particularly in our two municipalities, but we know that this is going to be a growing need throughout. So, not limited to us. Can you tell me how long your shifts last? I know it's only 4 days long, but
Yeah. And don't write this down because things may change, right? But right now we have 8-hour shifts with a 1 hour unpaid lunch. So they are technically on the road for 7 hours. They have already provided feedback. It's not enough time. And we just know that because there's so much work to be done out there. So our shifts right now, day shift is 8 a.m. to 4 p.m., evening is 4 p.m. to 12 a.m., and overnight is 12 a.m. to 8 a.m.
Okay.
No gaps in between.
And I'm sure there's different experiences on each of those shifts just in those 4 days that you've had, right?
Yeah, for sure. You can see a difference. Lots of shorter, quicker engagements happening overnight because there's not a lot of supports and service navigation required. Less engagements happening during the day. And I think that's just because a lot of more service navigation connecting them to supports is happening during that time. The team has done an outstanding job of providing detailed notes and saying, hey, day shift, I need you to do A, B, and C. It was just last night, actually. Our evening shift started off supporting an individual with getting to the hospital, and their shift was ending late, of course. But then we were able to have our own overnight team join that folk at the hospital. So again, providing that consistent support. And the truth is we may lose those people if we break for whatever period of time.
So what is your interaction specifically with police then during your shift? Because I'm sure not everything is silent night, calm. I'm sure there's situations. How does that work?
We haven't had specific calls from Durham Regional Police to,
But do you call them?
Yes.
Okay.
Just recently, actually, like the backdoor number, not necessarily the emergency number, but just because an interaction between a homeless person and a neighbor wasn't going well. So just to have them come and to be present. And then another situation actually as well at a hotel. But it ended well because we were able to advocate, speak to police, and he got to hospital, which is where he needed to be.
Right.
Sahara and I had a meeting with the hospital, Lake Ridge Health, Ajax, and Oshawa about some of what they're seeing, and what they asked was whether outreach could come, after 8 o'clock when social workers aren't there. So after having that meeting for the last 3 nights, they have been at both Ajax and Oshawa interacting with people who needed support. It's
And
just
so it's basically the right people are talking to the right people, right? And it's not it's not becoming a volatile situation when you bring in, like, not that police cause problems and nothing like that, but they do represent a different interaction, let's say. And so I'm very happy that, what you're saying, I understand what you're saying, and I think that's great. And I'm very, very happy that this is happening. So I'm assuming if all of you are on the night shift, is there a similar group of people that are on the day shift, or are there less people on the day shift?
So there's 12 in total right now. So 4 of them just came off the night shift and finished at 8 this morning.
Okay.
A couple of them finished at like midnight last night. And then one day shift team is here, and the other one's actually at Backdoor Mission in rounds right now.
Okay, cool. I'll stop asking questions because
That's
I'm
okay.
sure the 4 that were out all night want to go to bed.
It's a
Thank you.
fantastic group, like diverse skill set, great knowledge, and they've all brought such unique talents and skills already to this team. It's so exciting to work
And it's
with
about
them.
building trust,
Yes.
right? That's what it ends up, and at different stages in the day.
Yes.
Right?
And that's one thing I didn't get to speak to, and I did send a picture. I don't know if it can get put up maybe at the end. But what's already happened is that homeless folks are recognizing the vehicle and approaching. So in this short amount of time, they're already knowing that these are people that are going to help, that they can trust. So this is the team the day they got their ID tags, and we're very happy to have their badges, and that's them in one of the regional vehicles. So, you know, we worried about it taking time to build trust and build rapport before people are open. One example, and I don't know if I can share it or not, but I won't say specifics, someone who was being encouraged to go to hospital for a medical condition for the last couple of years by an agency with no success, went last night because our team went with them and stayed with them and advocated with the hospital. And he's still there now.
Amazing.
So, like, we're seeing these amazing stories, and it's just been a few days.
Excellent. Thank you very much. Thank you for all your hard work. Thank you.
Thank you. I think that's all the questions we have.
It's a clown car, yeah.
So that's all the questions we have from
Thank you.
committee. And just again, thank you. I think everybody understands the importance of what you do. Really brings critical information back to the municipalities, and we work with you well. And it always amazes me how much knowledge you have about the homelessness community and what you're doing. So thank you.
And we have been in every municipality. We didn't get to say that. Certainly Oshawa, Ajax, but Pickering, they're going to the north today. They were in Clarington yesterday. So we have been across the region, and we'll continue with that.
It's appreciated.
Thank you so much.
Thank you very much. So the next on our agenda, 5.4, is Lisa McIntosh, Director of Income, Employment, and Homelessness Support Division, and Sue Ritchie Raymond, a consultant with Tim Walsh Consulting Incorporated. Sorry. Oh, yeah, sure. Sorry, you're allowed to leave and go home and have some sleep. Thank you, Mayor Carter.
Can I begin? Okay.
Go ahead, thank you.
Good morning, everyone. I'm Lisa McIntosh. I'm the Director of Income, Employment, and Homelessness Supports with the Region of Durham. And I'm here to share an overview of the work that's been happening within the Income, Employment, and Homelessness Supports Division in the homelessness portfolio. I will start by setting the stage that homelessness is a complex issue. It's visible here in Durham, across the province, the nation, and the globe. We often say this, but it is important that we come to realize this as a statement that is true in our work. The complexities are due to the intersectionality of human services, healthcare, including physical, mental health, and addictions. It also encompasses poverty, and if it is not enough, the response to how those who are experiencing homelessness are perceived and supported is impacted on how the economy is doing in general. As the housing and homeless, I have to speak and click, sorry. Okay, as the housing and homelessness support system manager, legislated by the province and designated by the federal government as the community entity, we plan, design, and manage the system to meet our commitment to support those who are homeless and those who are at risk of becoming homeless. We also work hard to fulfill the vision that is set out in the region's strategic plan for 2020 to 2024, which is to support a healthy, prosperous community for all. Durham Region is changing rapidly. We are experiencing fast-paced growth in our population, post-pandemic physical and mental health challenges, rapidly increasing inflation and economic impacts, as well as an opioid crisis. As shared in our May and June presentations, our team is working hard to build a system of accessible, high-quality supports for vulnerable people in the community. As we build services to address housing and homeless demands, we must support people with equitable services, offering people the right tools and resources that fit their individual needs, so everyone is able to be part of our community. Working in system management in the region over the years, building up systems, committing to quality services from development, during delivery, and through ongoing assessment and improvement, this is not new. In the region, we are experts and we are experienced at building systems that are strong and that support people. We have an established commitment to working closely with community stakeholders and partners to ensure efficiency and positive impact for people. The responsibility of homelessness shifted to the Income and Employment Supports Division about 20 months ago. At that time, Orco Consulting was already working on a renewed homelessness and housing support system for the Regional Municipality of Durham report that was released in December 2022 and has been shared with all of you. It set out 24 recommendations and shared that our system needed to grow to meet community needs. In the spring of 2023, our staff team shared presentations and reports outlining information about the homelessness system and priority projects. Why am I sharing all this with you? Well, during the spring of 2023, Commissioner Danos Papakonstantino supported the team to engage Tim Welch Consulting Inc. to review Durham's homelessness system and services, with a goal of creating an integrated homelessness system action plan designed as a framework. The focus was to review past reports, gather and leverage stakeholder feedback, data, and best practices to ensure our priorities and strategic initiatives moved us forward while addressing gaps that currently exist in the system. I'm going to turn the podium over to Sue Ritchie from Tim Welch Consulting Inc. to provide a presentation on the review that of the proposed integrated homelessness action plan and the strategic priorities areas that the review has identified. Thanks, Sue.
Thank you. Good morning. It's a pleasure to be here today to discuss an overview of the Integrated Homelessness Action Plan. Before I begin, I thought I'd introduce myself. Having worked in municipal government for 32 years in human services, largely in housing and homelessness, focusing on poverty and the root causes, I have firsthand knowledge of the challenges that you're facing in your communities today. And I've enjoyed the opportunity to meet with your staff and community members to talk about the complexity of issues, the reviews that have been completed, and gather feedback to discuss the priorities moving forward. During my career, I had the opportunity to also work at Municipal Affairs and Housing in the Ontario Nonprofit Housing Corporation for periods of time to help with development of centers of excellence and innovation, which helps me in engaging with community members along the housing continuum and discussing those challenges. As you know, there's no simple solutions, but what is critical is having a plan to ensure that you're integrating service responses and you're looking at various sectors and the interconnectedness between those sectors, the interconnectedness between housing, social services, justice, and health, which is a critical part of the system. And that's both public, not-for-profit, and private sectors when we talk about the system, all with a focus on people and positive shared outcomes. Make sure I get the right arrow here. Oops, sorry. There we go. The Integrated Homelessness System Action Plan. The purpose of the work was to work with Durham Region to support the development of an integrated plan, as Lisa mentioned, to address the challenges facing the communities and to inform further strategic planning and investments. The scope is focused on creating a plan that will guide strategic actions for staff and the community, as well as directing investments for the future to address the most pressing needs and to inform longer-term objectives such as some of the advocacy, working with senior levels of government, and looking at increasing housing options that support strong and vibrant communities. As part of our background reports and reviews leading up to the study, in preparation, we focused on 3 key studies. Your At Home in Durham report, the 10-year housing and homelessness plan that was set out in 2014, and well, almost 10 years now, and I understand is under review at this time, progress has been made and efforts have been strong to focus on the goals of eliminating homelessness, providing affordable rent and for everyone in the community, enhancing greater housing choices, and building and developing strong, vibrant neighborhoods. We also reviewed the Durham Region Strategic Plan, so looking at your corporate strategy from 2020 that envisioned a healthy and a prosperous community for all, and as well the org code review that was mentioned. And after their extensive consultation, the report had 24 key recommendations that were included in our review to address the immediate needs, and part of our action plan is how do you put those into action, and what does that look like in terms of step-by-step actions for implementation. So just briefly, why take a systems planning approach? Systems planning is the analysis, planning, and design of an integrated system and define services that work together towards a common end. In the case to prevent, reduce, and end homelessness in your communities. It's holistic, so instead of relying on an organization by organization plan or a program by program approach, a system approach brings folks together to develop a framework so that the actions and outcomes of each of those components are working together and are aligned. They're not at cross purposes, and you're finding efficiencies, and you're evaluating the effectiveness of those approaches together. And it's person-centered. An integrated systems approach centers on the individual and then works its way out to the larger community. When referring to housing systems, there are a variety of models to be considered. I've given two samples here that are referenced in our final report. The housing continuum on the left, you'll see often in CMHC documents, Canadian Mortgage and Housing Corporation documents, it describes a range of housing options in a community, and it's based on income and support needs in the form of housing. From homelessness to market housing, ideally a community will have housing options along that continuum at all points to meet the varying needs. The wheelhouse model, which is on the right-hand side, is a more current model that's being reflected in many communities across Canada, which recognizes that housing needs and services can move in any direction, depending on an individual's life experiences and circumstances. It also recognizes that home ownership may not be an end goal nor achievable for some individuals, and the importance of a variety of options for the diverse and inclusive communities. Regardless of what visual depiction you use for what the system is you're trying to develop, the key priority is having a shared understanding of the key components and that they reflect the needs of the current system as well as the future system for your future residents, whether that's young people growing up and continuing to reside in this community, staying in this community and contributing, or individuals coming to the community. Ideally, your 10-year housing and homelessness plan will address all components, and the integrated system plan is focused on the safety net of the system. So we're just focusing today on the emergency housing solutions such as warming centers, drop-ins, outreach, along with the temporary housing options such as shelter, supportive, and transitional. Since the last update shared in August, there were 331 individuals on Durham Region's by name list as of July 23. Current data shows, as it's been mentioned today, that as of November, there are 415 individuals in Durham Region's by name list, which was a 20% increase from July. The by name list, as you are likely aware, is a tool that supports coordinated access in Durham. These individuals who are actively accessing the homelessness system, who have provided consent to receive support and matched with appropriate resources. The number of those who self-identify and access the system is often much higher, and you heard that report from the outreach team today. Just in their 4 days of action, they've identified a significant gap between those who are on the by name list and those who are in need in your community. This slide depicts the current homelessness service system in Durham, noting between 130 and 150 temporary emergency supports through warming centers, drop-ins, and outreach. Currently, there are 150 emergency shelter beds available supporting men, women, children, youth, and seniors, with an additional 4 beds scheduled to be available this winter. In addition, there are 44 transitional housing units that are available. This totals between 324 and 344 beds at any given night in the region of Durham that is available. In terms of the homelessness data, just quickly run through this. Durham has seen an 85% increase in families experiencing homelessness, and projections show that the anticipated 48% increase between now and 2025. And as you can see from the slide, there's a continued increase in actively homeless individuals from December 2022 to November 23, which aligns with the 2025 projections. So with respect to the action plan, we embarked on a stakeholder engagement strategy, but we respected the extensive engagement that was undertaken by Org Code Review. And our engagement focused on the key stakeholders who are involved in the system administration and actively part of that system, and worked with Durham Region to clarify for them the opportunities for improvement and feedback on what they felt the implementation priority should be and what they saw as their roles and responsibilities. We engaged in some key informant interviews, some site tours, focus groups, and some staff-directed community engagement. The focus groups engaged about 40 individuals representing a broad range of individuals from frontline service organizations, healthcare, emergency responders, and community responders, and that occurred between August and November. We met with service providers, we met with paramedics, we met with several area municipal fire department representatives, the health sector, Lake Ridge Health and Ontario Shores, and a number of community organizations, as well as Durham Region Police Services. So what did we hear? From the engagement sessions, we heard 4 key areas of desired community outcomes. So what were people looking for? They were looking for the expansion of integrated wraparound social services and healthcare supports. These services they felt needed to be better aligned and connected to ensure they supported the needs of the individual and to keep the individual at the center of the service responses and ensuring service providers were connected and that they were effectively working together. They identified the need for more quality housing options, so acknowledging the complex needs often require housing with supports in order to be successful, and that will be targeted to the individual's needs and available on site to support them to maintain their housing tenancy and avoid homelessness. They identified the need to increase cross-sectoral interagency collaboration, so an acknowledgement of the importance of resources and time for all sector partners. There's so much need to ensure that people are streamlining and there isn't overlap, but there's an alignment of services and that they're able to effectively plan and support the individuals they're servicing. That the services must work in tandem to meet the complexity of needs, whether it's through mainstream health and social services programming or whether it's through community agencies or faith-based service providers. Collaboration was really key to success for that individual. And finally, the importance of consistent and effective communication. So how to keep the public informed and organizations informed as to what's happening, and the importance of working collaboratively to ensure the public is educated about the extent of the needs in the community, the importance of the service responses, and housing and supports, as we know, are a human right, so working effectively together to ensure people have access to those supports. In brief, there were a couple key system needs that were identified through the data analysis, best practices, and community input, and I'll just cover them very quickly. The gap in support for individuals who are being discharged from hospitals, an inadequate aftercare process for those who are experiencing homelessness as those who are supporting those who are at risk of homelessness. So ensuring that the supports are there in the community to keep them housed to avoid homelessness. Due to a limited availability of shelter beds and insufficient post-care planning, some homeless people are exiting healthcare treatments or going back onto the street, and their illnesses are being exacerbated by the situation. Unsheltered individuals and those who are at risk of homelessness require more attention by the system to support their needs. In addition, seniors, commonly identified by the community as being critical need of support due to limited shelter beds and the acute need for affordable and supportive housing options, and that being seen as a growing need due to affordability challenges in the community. And one of the examples mentioned as, senior partners are together and one partner passes away, income is cut for the household and their living situation is no longer tenable and they end up in crisis. And what are the supports available to assist those? With 50% of the population being under the age of 40, over the next 5 to 10 years, there will be an increased demand for those 1 and 2 bedroom units, both rent and ownership, to increase as they enter the market. And 10% of the households in Durham are in core housing need, which means the individual's housing falls below at least one of the indicator thresholds for housing adequacy. It can be the affordability or the suitability of the housing that they're in, which means it could be over or under housed, and they would spend 30% or more of their total before tax income to pay the medium rent of alternative local housing that's acceptable. So with respect to the plan, we've developed a plan with the Durham staff with a vision of the Integrated Homelessness Action Plan for the region of Durham, addresses the challenges currently facing the communities and informs strategic planning and investments. The integrated plan has been developed incorporating the Durham region's vision set out in the Housing and Homelessness Plan to ensure Durham will be a united group of vibrant and diverse communities recognized for their leadership, community spirit, and exceptional quality of life. There are 5 key goals in the plan, and I'll walk through those on the next few slides. In those slides, I will highlight the key strategic priorities under each goal. There are recommendations under each of those that will be attached with the link in the presentation today to the final plan that recognizes that there are some activities that are underway, some of which you've heard about this morning, like the outreach program, and there are others that will be discussed with committee through the budget process as well as future presentations after discussions with partner organizations and plans are pulled together. In total, there's 32 recommendations over the next 2 to 4 years that includes 80 recommendations. So the first goal is implementing system integration and planning and management to help foster exceptional quality of life and well-being for all residents. The key strategic priorities here are demonstrating leadership in the homelessness prevention and response, collaborating across sectors to ensure value for investments in quality services, engaging community members with lived experience to inform the system plans. So we're hearing from those who are receiving the services or have received the services to help inform what's designed, and data management, so really improvements on data that's collected that can help inform decision-making for the future. The second goal is improving system capacity and service levels. So in order to provide exceptional value to the Durham community through a range of service options, as well as responsive and effective service delivery. The key strategic priorities are optimizing resources and partnerships to deliver exceptional quality services, collaborating for a seamless service experience, developing service responses to meet the needs through collaboration and evidence-informed decision-making, ensuring service quality and accountability and having metrics to measure that, and expanding homelessness prevention initiatives. The third goal is to ensure a range of services and supports are available and accessible to those in need so that no individual is left behind. And the key strategic priorities are ensuring system design and investments provide service access, creating strategies to respond to service gaps, and investing in housing as a solution for homelessness. The fourth goal, to achieve system excellence, which is to build a strong and resilient service system based on investments from all levels of government, community, and private sector, and supported by a strong system management and accountability. The key strategic priorities are looking at leveraging community assets to ensure service delivery and quality, enhancing communication to increase public awareness of needs and access of services, and demonstrating commitment to continuous quality improvement and accountability. And the final goal is developing a sustained increase in housing supply across Durham region to meet the needs of all residents across the housing spectrum through the Housing and Homelessness Plan. That includes 2 strategic priorities, increasing the number of affordable units, and in particular, increasing the number of transitional and supportive housing units to meet the needs of those with more complex needs. And I'll turn it back to Lisa.
So I was just going to skim right over this infographic, but the numbers, I saw Stella's face earlier. So July, the numbers for July on the by name list were the 330 numbers that you've seen in this infographic prior. Jocelyn used a by name list for 360. I think if I have the right by name list update, that would have been the end of September or October's number. And then November's number that has been recently posted in December with the update is 415. So what it's showing is that continual climb. And then again, as Jocelyn noted, we are expecting another climb once we start to build trust with the unsheltered in the community. So for anyone who is keeping count, it is moving up consistently. So my next few slides, I'm going to skim over very quickly. You will realize they are exactly what Sue just read to you. They are the goals and key strategic priorities that have been identified by the latest review. What I want to share is that what the review, so we had 24 recommendations with org code. We have now 42 recommendations with Tim Welsh. And it's important to note that what the Tim Welsh Consulting has included for us, has really provided for us, is a consolidation of all the information and an affirmation that our assumptions and our assessment over the past 20 months really does align. Areas of development and where the recommendations lie, they fit. Then they've worked with us to ensure that there is a framework inclusive of a measurement report that is nimble. So it's allowed us to work as a team internally in the Homelessness Supports Division to ensure, I'll move closer to the mic, to ensure that that we really do have an operational work plan that aligns with this action plan, and that we're able to report back to you regularly and really support and share the activities and the progress that is being made. So currently the report is up online. We are adding the 42 recommendations as the appendix. It will be there probably tomorrow afternoon. We wanted to share the presentation and ensure that you are aware before you started rolling through what feels like a huge undertaking to move forward within the region. Our work plan is designed in a way to make it manageable and to set it out over a number of years. So for goal 1, we've already implemented and made huge strides in moving forward our leadership in homelessness prevention and response. Currently, I have Sahar Furatani, who is the dedicated manager who is supporting system management of the homelessness system in Durham. And I also have Jocelyn Siciliano, who's the manager focused on direct delivery services in homelessness. Positions that were focused directly on homelessness didn't exist in my portfolio when homelessness shifted over. We had a manager who was working on both the employment services and supports area of our regional portfolios as well as homelessness. This allows us to develop out and to operationalize an outreach team in 6 months. I know they didn't have their uniforms today, but the fact that our staff are in place and trained within 6 months is a major undertaking in the region, and it speaks to the amazing dedication and the work of my leadership team. As I move through, I will move on to goal 2 and share some of the work. Actually, this one hit for a lot of people, data management. So we're currently building a dashboard and maps for efficient allocation of resources and to ensure that we're meeting demands across the region. And we're doing this in partnership with other municipalities. And we are meeting regularly with municipalities who are beginning to map and to work through and connect their service delivery models to evidence-based data in the local level here in Durham. And so those meetings are underway, and those the dashboard is being built. We're also working closely with the federal government to support and seek out system enhancements to HIFIS. So those would be items that would be on the operational work plan related to these higher level goals that you're seeing. Goal 2, one of the things that we have operationalized is work with DRPS, bylaw, and Durham's outreach team. They're currently in discussions to coordinate and enhance response to encampments and also work within the hospitals. As we move forward, goal 3, we have been working on system planning and networking activities, so those will occur on a regular schedule. We won't need to pull through a large review to continue gathering updates from our community and really doing activities and initiatives to work together to figure out and identify challenges that may be presenting new gaps in the system and also solutions to solve the issues as they arise. So we had our first Homeless Day event back in the fall, and that brought together stakeholders from more than 80 organizations, including our local municipalities, to talk about gaps in service delivery in the homeless system. But it was also co-produced between our regional homelessness team and the integrated planning committee that is led by Lake Ridge Health, because they have a goal of supporting homelessness in this year as well. And so we work together to gather data and to really build the bridge in that resource, in that initiative. So with goal 4, one of the work plan items that we're working on is updating our website to include key public awareness information and messages, and developing out a really clear postcard and information sheet that can be shared broadly so that the homelesshelp@durham.ca email and contact information is available and accessible right across Durham region. Goal 5, we are excitedly anticipating the opening of Beaverton Supportive Housing. We're developing housing options in the future phases of 1635 as we plan and gather that with community engagement. And we're continuing to partner with our housing division to roll out COB and rent supplements as they are available to those who are most vulnerable and really need those benefits to be able to stabilize housing. So, what are next steps? Definitely ongoing reporting. We are looking at bringing presentations and information to this committee on a quarterly basis and ensuring that we're giving you updates in the work plan and work that's happening in the community, and really using opportunities to build out an investment strategy and ensure that we are reaching out and working with both our community partners and internally where it's available to access any community grants, federal, provincial, or others that are available, and ensure that we're proactively budgeting in future phases of the budget to ensure that we're meeting growing needs in Durham. So,
thank you for your presentation. We have questions, couple. So, Mayor Carter, you want to go first? I know you're.
Thank you very much,
tight
Madam Chair, and
timeline.
I have to excuse myself in a few moments, so I do apologize about that. Lisa, thank you very much for your presentation. I just want to ask, there's a couple different things. One of the things that I noticed is there was no discussion in regards to modernization of our shelters and expansion of our shelter system in this plan. Did I miss it?
So the last key initiative is increasing number of affordable housing units. And we are definitely speaking to shelter as a placement on the continuum of housing. So yes, we are looking at shelter, but shelter is always our last resort. We know that we need to build that in Durham, but we are building and looking at options for affordable, supportive, and transitional housing.
I get that, but both have to be done simultaneously because we don't have enough shelter space. They're not modernized. I know in our city, we're still, it's one of the reasons why we can't get people indoors is because the shelter is not modernized to today's complexities of individuals. We absolutely have to undertake that.
Yes.
And I'm asking that, I've been on this for 3 years now about the modernization of our shelters.
So
And I haven't seen action on that as of yet.
Through the chair, all of the spaces that we've built out are in modernized capacity, and we are working with current shelter operators to be able to modernize both their program service delivery to ensure that full day wraparound services are in place, as well as the spaces that are available when they exist. A lot of times they are grandparented, but one of the things we have done this year is implement a program review process, and that is one of the work task items on an operational level, is that we are updating that program review that was piloted based on research-based evidence and really including research-based indicators of quality to improve that. Our shelter standards are also being updated to include key physical elements that are required to make a shelter space a safe and more welcoming space.
So I appreciate the work you're doing, but I need construction to happen. So in our circumstance with Cornerstone, you've had those conversations with Cornerstone. Cornerstone is undertaking modernization of their men's shelter?
Not at this time.
No, not at this time. That's what I'm talking about. That's what I've been asking for 3 years now. We have to modernize those because people will not go into these shelters. Dormitory shelters don't work. They're dangerous and we've got to get it done. So I appreciate the work you're doing, but we need either dollars allocated, plans put in place, and shelters to be modernized. I don't want to sit here 12 months from now asking the same question again. So I'm hoping that my point is clear and concise. Madam Commissioner.
Commissioner has something to say.
Yes, thank you. Through the chair. Yes, I agree with you. This is an area of challenge when you're not the operator of the shelter and you need to work with a particular board. I'm not disputing your comment. We
Right.
completely agree and support this. And I believe Director Alan Robbins also wants to step in as he's had the previous experience
Okay.
in working with.
Tell us what we need to do to help.
Okay, through the chair. Yes, when we're looking at the shelter modernization, we are going to be impacting capacity because, as you know, they're crammed in
Yep.
pretty tight.
Yep.
So we do need to increase capacity across the system, as Lisa had mentioned, in order to do that in conjunction with shelter modernization. I have been in contact with Cornerstone numerous times with respect to possible expansion and creation of supportive housing units, which we know are much better than the style of shelter that they currently have. I believe that they've been in talks with city staff. There's a number of barriers, but in order to modernize the space, they're going to need the cooperation of the city to create the type of housing that I think you're looking for, that's
Right.
stable, that allows people to stay in their unit throughout the day as opposed to being on the street
And
during
I-
the day.
I-
So I think there's a lot of opportunities.
Right.
And they do have a great track record with respect to their other properties on Bloor Street for providing quality housing for individuals in very stable environments.
So here's the point I'm trying to get across, is the municipalities, their hands are being tied because under the charter challenges that have happened, if we don't have a place to be able to take them to a shelter, right? Encampments are allowed. And I find that unacceptable. Champion encampments in minus 35 degree is unacceptable. We have to do everything we possibly can to expand our shelters. I understand the housing component, I understand the wraparounds, but we've been having this conversation for 3 years now. And I'll be honest with you, right? You're pushing municipalities, right, into a legal position and a safety position, right, that is giving us no choices. I've read every decision that has come down in regards to the Kingston decision, the British Columbia decision, every decision comes about. And we're trying to make sure those individuals are safe. But if we don't have shelters, they're entitled to encampments. And encampments are the most dangerous place for these people to be.
And through the chair, the creation of housing and supportive housing does free up space in the shelters. So not only is support from local municipalities needed to help generate those additional units, but when we are talking about increasing shelter space so that people aren't forced to live on the street, we're also going to need local municipality support to deal with NIMBY, which is a growing
Absolutely.
concern and definitely does set back projects.
Absolutely.
So
we
it's support
experienced
from all levels.
Right, and we experienced that in Oshawa. They've experienced it in Whitby in regards to NIMBYism, and we've had to fight that all the way through. We understand that. Matter of fact, and we've identified properties that are available for microhomes. We've identified properties that make it available. The shelter system has to be addressed, and it has to be addressed. Like I said, I don't want to come back here 12 months from now, and if somebody says, well, we finally finished the study, and we're trying our best. We need to see an expansion of the shelters. We've heard about the youth. We don't have enough youth. We've got seniors now that are facing the streets. You're forcing municipalities into a charter challenge that I think, right, is unfair to us as municipalities. We're trying to make sure that everybody does. The first thing we do, Madam Commissioner, is we ask individuals, how can we get you to a safe environment? What shelter can we do? And we get on the phone, and if that's in Lindsay, or if that's in Cobourg, or if that's in Port Hope or Mississauga or something, we're trying to help people there. Why? Because of the reason that we don't have this system here, and the ones that we do have here, they feel that they're unsafe because they are not modernized. So please take that under consideration. The next question I have is, there's a goal 5. It says boosting system growth of housing supplies. It says increase the number of affordable houses. How many? What is the target? What are we committing ourselves to?
So
is
for,
it 5,000? Is it 2,000? What is it?
Through the chair, for us, the goal is a priority goal. We set work plan items that are fitting with the homelessness component of our work under that. So really our focus is looking at developing out units that are supportive housing units to support those who are high acuity, take pressure off the shelters, expanding shelter spaces, and this winter alone, expanding winter warming spaces that allow for individuals to come indoors. With challenges, obviously, there are individuals who do not want to come indoors if there's only a chair as an option. So we are working through those pieces. Again, this is a 20-month in-work progressive plan that will take us through the next few years. But modernizing shelters, developing out supportive and transitional housing options is our work. The 10-year housing plan that is being developed now with the housing division, that will start to set the parameters on affordable housing units across the region that are required.
So when does the commitment of 1,000 units, when does that come to end? 2025, correct?
Through the chair, yes, at the end of this year, we would like to have the 1,000 units in place, not in place ready, but in process.
Okay, so, and is it at the end of this year that we'll then be setting targets about how many more affordable units we want to accomplish
We hope to
yearly?
set the target earlier than that because we are currently working on the new housing plan, and there will be a session in February with council to engage you in that process. So that'll be the opportunity to talk about the next 10 years.
Okay.
So just want to ask if Elaine wanted to jump in here.
I do. Thank you very much. I think we've been pretty clear that expanding affordable, supportive, and shelter space across the region is a priority. I really have to underline what Alan said and the importance of the support of local municipalities. I think what staff have gone through, including local staff in Whitby, in the past 6 months says a lot just to try to open one shelter. The other thing is these initiatives all cost money. You've seen how much the region has grown with respect to what it is investing in supportive and affordable housing and shelters. So it's critically important to achieve our targets. We cannot do it alone. We need support from the provincial and the federal government. And I don't think that can be lost. It does not rest on the region alone to address this issue. We're doing our best to access additional resources across the board.
Yeah, I don't disagree with you, Madam CAO. As you know, we still have been waiting for a response from the federal government that refuses to answer our correspondence that was registered mail to all 3 of the leaders. I clearly understand that. Congratulations to Toronto for taking 95% of the dollars out of the federal budget and leaving 5% for 440 other municipalities. And I agree with you. The province and the federal government have to be partners. Unfortunately, the federal government truly believes that there's no place called Durham Region. Plain simple as that. They can't answer a letter. So, you know, I agree with you 100%. I just, you know, we're in a state of emergency, folks. A state of emergency. I don't know how much more we can say this, right? We've got thousands of people that are living on the streets. We had Mayor Guthrie speaking the other day on CTV. People living on sidewalks. It's unacceptable. And without the help of the provincial and federal government, I got to be absolutely honest with you. The regions, the municipalities are trying to do our best, but this has got to stop. You know, we made the announcement with the refuge in regards to the $5 million that Minister Calandra was brought. We had every media outlet that was there from Toronto. $5 million, 27 apartments, going to have roaming stations. Region's excited, they're part of the partners. Do you know, all of the media there, not one of them asked a question about homelessness. Asked a question about everything else. I had 505 overdoses last year in my community. I had 73 overdoses in my community in December, the highest we've ever had. And I've got people sleeping in encampments that I can't place anywhere. Why? Because of the reason that the provincial and federal government, what do you call it, are turning a blind eye, not just to our community and our region, but all across this country. Enough. Anyways, I have to go.
Thank you, Mayor Carter. Appreciate you. Next on the list is Councillor Anderson.
Thank you very much. Thank you for the presentation. Nice segue from what Mayor Carter. I'm going to build on that. I agree with Mayor Carter wholeheartedly and everything he has said, but I'll expound on that a little bit more. We just bought 1635 for what, with improvements, whatever, it's probably over $20 million, right? With all the improvements in addition, for 40-something residents, 40-something folks, homeless folks is going to use it. That's roughly, quick math, over $400,000 per resident. That's a facility that can hold 100 and something thousand people. Why are we tied to 45, only not using that? We're talking about the crisis that exists, and it does. Why are we that's not being utilized to its fullest? I want answers for that, and you know, community folks, my residents are asking, why would we spend that much money for 45 or 47 people? And it's time so we can hold the federal government, provincial government, but we have to lead by example as well, and make sure we utilize all the resources we have to help these folks that are on the street. So maybe the director can provide some answer for that, or the CEO for that, because I think that's unacceptable, to be quite honest.
Through the
Perhaps
chair.
I'll start.
Oh, go ahead. Sorry.
Yeah, just to point out that this is a very large facility at 1635, and it was never envisioned as just a shelter. The shelter is certainly phase one. We're already well into the planning process to look at converting the rest of the building into supportive and transitional housing that will serve far more than 45 individuals, and it will include all of the wraparound services. Where we are right now, though, again, it's critical that we do get investment from the provincial and federal governments to help us with this and other housing initiatives. And we are taking MPs and MPPs in tours of 1635 to encourage that support over the next couple of weeks. And I'll turn it over to Lisa, who may want to add more. Sorry to jump in, Lisa.
Through the chair, you did great. That's exactly it. The site is not, the end point is not going to be 45 people, 45 emergency shelter beds. And again, when we look at that continuum and the wheel that Sue Ritchie-Raymond shared, it's really important to remember we're moving people along a continuum. So supportive and transitional housing units within a facility allow people to come in when they need that emergency space. but it allows us to find them a unit that's a fit. They could end up being somebody who has the acuity to live independently in affordable market value homes as once we get them through the employment system and move them along service delivery. They may need to move directly into supportive housing, and that could be the option that's a fit for them. But we need to look at where people fit in the continuum and move them along. Emergency shelter is the beginning space to bring people indoors. So now we need to build up our capacity to move people into more stable options where they can stabilize both financially and socially and emotionally.
Why we're not articulating that? Why is that not being articulated, that it's not just for 45 people? The perception is that it's a shelter that's going to accommodate 45 people only, and we don't know what's going to happen to the rest of it, and that's the message that's being conveyed out there. Why are we not saying that, yes, we're going to use that to its fullest capacity to help those folks that's around the street, get them off the street? And you know what? It's better we have them all together. Policing costs will go down. So there are factors that springs from having folks in that as a community. So please do articulate that's how the facility is going to be used.
So the agreement that council moved forward with us and Whitby, it does speak to the engagement that's happening and that you will receive plans for the rest of the building. Currently, the 45 spaces take up about 1/5 of the building. So there is significant space there, and we've been saying to run enrichment programs for individuals, so wraparound supports and community agencies. There are opportunities to have different types of support services, supportive housing and transitional housing in the building. So the whole capacity of the building is a lot larger than the space we're focused on right now for emergency shelter, because that is our primary need to initially get people moved indoors and off the street, to get them out of chairs and warming centers and into a bed, and to have a space where they can stay all day long.
Thank you for that. And I know that's not nearly enough, but at least it's a start. So let's get on with it. Thank you.
Thank you. Mayor Foster?
Well, thank you ever so much. And you're getting a bit of a rant. The reality is the decisions are made by the elected representatives as to whether we're supporting them here locally, whether we're supporting them at the municipalities, and whether we're supporting the amounts of money in the budget to do these things. So I've got two very different questions or observations on communications, and then a question in terms of supportive. On the communication, to follow on to Councillor Anderson's point or questions, and there was a note about public education around the whole homelessness, affordable housing issue. We all know that a homeless shelter, and if you're reading the news across the province, that the communities are demanding that these things either not exist or be pushed somewhere where they can't exist. And I guess I would like to know if we have a strategy, and a broader strategy than just Durham Region, to try to combat that NIMBY. Because the shelters are one thing. Each and every one of us around the table know that not that long ago and still today, if you came forward with affordable housing in your neighborhood, chambers were filled with people being upset. If you came forward with rental, not necessarily affordable, I did have someone in chambers not that long ago. The only people who rent apartments are drug dealers and prostitutes, which was odd because when I got married first, well, maybe I should have asked my wife whether she was a drug dealer or not on that. But there is a significant piece on the NIMBY. With the strong mayor's powers, and Alan, I'll look at you, maybe each of the lower tier municipalities should be passing motions where council, in principle, is supportive of affordable housing, accessible housing, shelters. I don't know, but I wonder if I can leave that with you, that we're responsible. But again, on the communications, we need to deal with the NIMBY issue. There's a housing crisis because of federal funding, provincial funding. There's a housing crisis because we, and I include myself in that, bowed to the demands of the community that we not build high-density housing. Plain and simple. You know, we're responding to what society says that they need on the NIMBY basis, and then more broadly, we are all hearing that people are upset and concerned, now seeing people on the streets and homeless. So on the public education bit, you know, I wonder if we can leave that. And the other bit on the public education, to follow on Mayor Carter's comments, are the GTA regions, and I'm excluding Toronto, front page news, your taxes are going to go up 10.5%. I keep seeing this because the feds aren't stepping up. I have a prediction. The feds are going to step up. We've got significant tax increases here and right across the GTA. Are we capitalizing on that? You know, Toronto is, as much as frequently they think they are the center of the universe, we're the center of the universe for our residents. So can I leave that somewhere with staff to see if working with our partners, and I have some concerns with the consultants that we use for the engagement, because I know that they will drop clients that are adversarial towards the province. But at some point, you've got to be adversarial towards the province. At some point, you've got to be adversarial towards the federal government. You know, this is a huge issue. And I'm going to flip it around completely and stop the rant. On the public education, can we consider how we can speak to the people of Durham Region to look at the progress that we have made? So I can tell you yesterday, I heard from a high school class. So these are high school kids that are asking what we're doing about homeless, what we're doing about attainable housing. They've got a stake in this 10 years from now. But we have made huge strides. You know, in the last budget, money that should not be on the property tax is. We don't have a choice. We're dealing with it. I look at what Durham Nonprofit is doing. I look at what the local housing corp is doing, the intensification. Don't know what the other providers are. But we are really working and having success at that. But I'm not sure we're articulating that to the public in a fashion that they can see. So we know that people are desperate to know we're doing something. We're doing a great job. Thank you all for that. But I wonder if we can consider better communications around that to get out to the public saying, guys, we are trying. And then the last bit on the supportive housing, as you are looking for current providers. And Alan, I know that you and Madam Commissioner, you're aware as well, and I thank you. The nonprofit brought a number of services together, emergency services. We have a very limited number of tenants who are incapable of living on their own, but have to live on their own. So in one case, it's Spot and Brock, there were 6 calls in one day from the same unit to the emergency services. But that's a volunteer service. So the paramedics know exactly who this individual is. The police know who the individual is. Emergency services know who the individual is. We've got a number of tenants like that. Without the supports, they're incapable of living alone, and they are costing taxpayers hundreds of thousands of dollars in diverted services. So as you're looking at that, I wonder if you can look at some of the existing service providers, see what supports can come in for the existing providers, because I've got to guess, I understand there are about 90-ish not-for-profit providers in Durham. Alan, I'm looking at you. I don't know why I think you should know this, but you're right across from me, so I'll pick on you.
Through the chair, as you know, we're working with Durham Nonprofit on a potential pilot moving forward. This isn't a new problem. We've had, within our local housing corporation, we've had clients that were calling 911. They were responsible for hundreds. And we're looking at different initiatives and partnerships with different agencies. But at the end of the day, you can't force someone to leave their home to go to a supportive environment or even to long-term care.
So Alan, I'll cut you, I don't want to be rude, but I'm going in
no.
a different direction, with this, that it isn't a new problem. And even if you look at, the police calls to particularly downtown Oshawa, a very limited number of people that don't have those supportive services are putting tremendous drains on the entire system. And the province needs to step up. We can spend a nickel to avoid spending a dollar. So we've known about it, and the work that you are doing, thank you. We appreciate it. But I'm hoping that we can address this in the plan. And I know I keep saying this, but moving forward with advocacy, whether it's motions coming forward here, and at the local municipalities, but actually trying to take some tangible positive steps forward to fixing something that we know has been problematic forever and is a complete and utter waste of money and unfair to the people that are caught in a situation where if those individuals left, they would end up being in a tent somewhere. They don't have anywhere to go and they're not capable of being on their own. I'm sorry, that was my rant. I'll stop now.
Go ahead.
Through the chair, I just wanted to comment on your rant. Homelessness is an economic problem. It's a housing problem. It's family dynamics. It's mental health and addictions. And today we're seeing people being evicted from their homes because the landlord has the opportunity to do so, wants to be able to raise their rent. And so we're seeing families, we're seeing seniors because they've lost a partner and are now living with one income. So, it's a very complex situation. So we do need more shelter space because those who are living on the street need a place to come in. We need low barrier shelters as per Mayor Carter's comments. So in order for an encampment to not exist, we need to have a low barrier shelter so people can come in without any barriers to receive those supports. But we really do need affordable housing and supportive housing, because just housing someone, as we have found, we can house someone, but they're back on the street if they don't have the support. So we talk about those wraparounds, that is exactly what we need, and we do need the funding to be able to do this.
So just in response to that, Madam Commissioner, as much as I was talking about lower tiers and their strong mayor powers, which I don't know the province anticipated that the mayors may use this for this. The chair does not have those powers. I'll leave this with you. Is there an ability for this group, councillors, to put their hands up that we will support in principle with the appropriate safeguards and studies and whatnot, but that in principle we will support that variety of housing required. Because it takes a lot of political guts, and it doesn't matter where you're going to try to do any variety of these things. It's difficult. So I'll leave that thought with you. I might live to regret that.
Thank you for your comments. We have no one else in the queue to speak. So again, thank you very much for the presentation.
Thank you.
We look forward to moving ahead on some of the recommendations.
Thank you very much.
Thank you. So looking at going on in the agenda, we do not have any delegations today or correspondence. We do have a report 8.2 under social services, and it's approval to accept a one-time federal funding for the Reaching Home homelessness strategy. So I have two movers. Are there any questions? Do you have okay. Did you want to speak to that, Mayor Foster?
I do. Just a really quick question. It's not enough, but we'll take it. The second is I didn't see anything in the report suggesting how we might spend that money, where the priority would be, and I think the challenges are probably 50 different priorities.
Through the chair, the purpose of this funding is to support us with our warming centers, and that's why it's time limited to April 30th, 2024. So it is very essential, especially this year with the expansion of our warming centers.
Is that it? have any further questions?
But just a very quick comment. So I suspect that Clarington is a beneficiary of that, and thank you for that work, or at least a partial beneficiary.
Thank you. Councillor Jupp.
Thank you, Madam Chair. Through you to the Commissioner. How does this relate to our budget? As we know, we have a budget guideline of 7.5%. As these are coming in, hopefully more funding in the next couple months before March at budget. How does this affect our budget? Like this to me looks like 0.25%. Am I reading that right?
Through the chair, it's how will it affect our budget? It's almost already spent.
Okay.
Because we were already using our homelessness prevention funding to help us with our warming centers and our shelters and our hubs and our outreach workers. So we've already, pretty much spent this funding, but it is going to help us through the coming months.
Okay, and as I mentioned, hopefully more money comes in the next couple months, which is somewhat expected. Is that going to affect our budget moving forward?
It will help our budget as we get more funding, and I hope through your words to our other funding levels that we do see more funding come in.
Okay, thank you.
Thank you. Councillor Anderson?
Sorry, I should have canceled that. My question was asked by Mayor Foster and answered. Thanks.
Anything further? So I need a mover. Anderson, and seconded was Mayor Foster, is that correct? Okay. All in favor? Any opposed? Thank you. Appreciate that. So we don't have anything else on the agenda really for today other than an adjournment. Need a motion? Councilor Jupp and Anderson, thank you very much, and thank you to all the staff for being here today, and people in the gallery, it's much appreciated.